Okay, well, I'm Doug Franzen. I have written a lot of multiple choice questions in my life, and I want to share that experience with you. So just real quickly, while we're waiting for people to kind of trickle in, I'm just curious what, those of you that are here, what your interest in this is. So let's just go around the room real quick. Like, why are you here? This seems like a terrible, boring, horrible session, so you must have a reason.
Jacob Klaus, I'm a background's a paramedic. I write a lot of questions for
Okay, excellent. We're just saying why in the heck you chose to be here instead of hanging out in Atlanta.
I'm Mike Rahman. I work on the Louisiana campus for VCOM, and so help write lots of questions for their curriculum as well.
Did you and I meet up in New Orleans one day at lunch? Okay, yeah, totally random meet up that day. That was kind of cool. All right, how about this table?
Hi, I'm Dunn MD. I'm coming from Columbia Medical School. Just started a clerkship here. So, you can write any questions for the students.
Hi, I'm Eric Weinstein. I'm at USF in Tampa. The ABMS has approved a disaster medicine fellowship.
Oh, nice.
And I'm working towards that. I hope to be involved in the test. So I want to learn how to write questions for the test.
Cool.
But I probably won't make the cut, but I want to at least try.
You'd be surprised.
Hi, I'm McKenna Mitch. I am a Clerkship Director from Medical College of Wisconsin. So I've never written a multiple choice question, but I know my students answer a lot of them, so.
Okay.
Hi, I'm Sue Watts from Texas Tech El Paso. I'm research faculty, and a lot of my colleagues write multiple choice questions for surveys and knowledge assessments and stuff. And sometimes they're not really good, so I want to help them improve that.
Okay, excellent. That's a good reason to do this. How about the very back table?
My name is Josh Davis. I'm an emergency medicine doctor in Wichita, Kansas. I am a skills director for an osteopathic medical school, so I'm interested in developing some effective multiple choice questions you can use in that kind of area of undergraduate.
Cool.
Amy Cutright. I am involved in student education at the University of Nebraska, so I'm looking for a couple things. I'm hoping to get involved in item writing for emergency medicine questions, and then I also have to oversee a faculty group that's trying to improve the multiple choice questions for our preclinical curriculum, and I just need a little bit more skill set to be involved with that.
Okay, fantastic. Have you done this workshop before? Oh, I thought maybe you had. Okay. Well, so it's a two-parter workshop, and I'm going to spoiler alert that you guys are kind of free labor a little bit. But so here in the room is Navdeep Sekhon and Tom Alcorn. And all three of us are on the NBME committee that maintains the ACE exam. So Amy, if you're interested, I can show you how to apply to do stuff for the NBME. And actually, if anybody else in the room is interested, it's a really fun gig. They fly you to Philadelphia to write a shit ton of multiple choice questions. But what we really ultimately want to do is we are constantly working on the SAEM exam, the free exam that a lot of clerkships use as sort of their final exam for clerkship students because they don't want to pay for the NBME ACE, which is an expensive exam. And so towards the end of this, we will go through a bunch of questions that have been written and submitted as potential candidates for the exam. I apologize a little bit for some communication stuff. Usually I get the list of people who are participating a week or so in advance, and I say, hey, write 5 or 10 questions and bring them with you and we'll workshop them. And I didn't get that list until yesterday. So, but if you happen to just have some questions in your pocket and you want to workshop them, like bring them on up and we'll add that to the list. It'll be good fun. The only disclosure I happen to hold some stock in Johnson & Johnson. I promise we're not going to talk about baby shampoo or anything like that. So I think we should be good. And Tom and Sarah and Deep haven't quite figured out how to monetize this just yet, so they'll get there. But we're going to talk about multiple choice questions and how to write them effectively and how to look for flaws and how to take a good question and make it a better question, and basically a lot of the things that you guys in the room said that you would like to do. So I think it's important to start with kind of the 10,000-foot view. You know, why do we do tests at all? What's the point of all of this, right? And I think one of the big ones is to just motivate our students to learn. This is going to be on the test. And that sort of goes hand in hand with sort of emphasizing what things are going to be important, right? This is going to be on the test. You might want to learn this. I think that's kind of a proactive reason to write a test. And then there are some retroactive reasons, right? We can look at how students are doing. We get some information about their overall performance and whether or not they've learned the material. And we also get some information about our course and our overall curriculum. What are things that students have learned well? What are things that maybe I, as an instructor, need to do a better job teaching so that my students can do better on that test? And those second ones, obviously, you can do. It doesn't matter if you're the person writing the test or not. The first ones, I think it's a little bit trickier. Obviously, you know, if you have no control over what goes on a test, it's hard to be like, hey, by the way, you got to learn this. So some of the goals of testing, right, are to assess for mastery, and that can be used in two different ways, right? We can just set a threshold, and if you know X% of the information, you pass the course, or you pass the curriculum, or you graduate medical school, or whatever. We can also look at skills, right? We can have practical exams where you have people, you know, demonstrate the steps of a central line, and we have a checklist that watches that, or, you know, the old step 3 exam, right, where you did sort of the practicals and the OSCEs and stuff like that. We can use goals to help discriminate students, right? So in addition to just making this nice pass-fail clean line, we can actually say, you know, students who did better on this exam get a higher grade or are ranked higher, or however you want to think about that. And we can also kind of get a sense of, you know, students are doing well in this area but not as well in that area, right? And I think that's the value of some of these big standardized tests where you get a breakdown of, you know, your cardiology score was okay, your respiratory score was fantastic, you really need to put some time and effort into learning endocrine. So when we think about building a test, where you actually first start is not writing questions. You create what's called a blueprint. And then you actually build the test, you give the test, and ideally, in the best of all possible circumstances, you kind of see how your test is doing, and you revise and revamp the test by pulling items from your item bank. And that's really what we're here today, is to create an item bank. And I'm going to talk about all these steps in just a little bit more detail. So a blueprint is the overall picture of your test, right? You look at the content, the curriculum that you're trying to match, and you say, okay, we have, you know, 10% of our curriculum is on cardiology, so approximately 10% of our test items should be on cardiology. 10% of our curriculum is on GI, so approximately 10% of our items should be on GI. Obviously, you should weight your topics according to their importance. And if you've ever looked at the breakdown for how ABEM does the ITE exam, right, you know, there's a lot of emphasis on cardiology and trauma and stuff like that, and a little bit of emphasis on some of the smaller topics like, you know, hem-onc, for example. And so you really kind of want to have this breakdown of test questions and test items that matches what your curriculum looks like, what things are important to you as a teacher or to your course, and where it fits in. And then the amount of time that you spend on these items should also kind of reflect how important they are. So if you just want people to have a basic knowledge level of things, you might have a couple of quick questions. If you really want them to demonstrate mastery, you might have a half-day in-person OSCE where you're going to walk them through a whole bunch of steps and have them do a whole bunch of stuff. We have people peeking through the window. They're super interested in what's going on in here. Come on in. Hello. Can we help?
Oh, I thought you were waving in.
Oh, you were peeking in. I thought you needed to come in.
Yeah, all right. Oh.
I think everything's going great. We got good audio, right? Everybody can hear. Computers, things are working perfect.
For the record, can you kind of speak into the microphone?
Oh, sure. Sorry about that. Okay.
Okay.
I like to move around when I talk, but I'll try to anchor to the podium. No, that's okay. I'll just stand here. Look like an idiot. It's all good.
Okay.
Thank you. Okay, so in terms of building a test, you know, we want to have a couple of different items to consider here. So number one is sampling, right? What, in all the universe of all the things that I could test on, what are kind of the subset of items that I might use to build a test to then emphasize those things in the curriculum, right? So in all of cardiology, what are the 5 or 10 things that I might pick and choose to say, did the student learn cardiology to the level that I think they should know cardiology? Feasibility has to do with how, can we actually test this item, right? I think like an ideal test for an emergency medicine resident would be like, listen, we're going to have you work in the department for a week, and we're just going to watch every single thing that you do, and we're going to make a note, and then at the end of the week, we're going to say, here's what you're doing well, here's what you're not doing well, right? But to make that into like your board level exam, that's going to be a really difficult thing to do. And so we create this artificial scenario down in North Carolina where you talk with an imaginary consultant and kind of have that same sort of scenario, right? That's a feasible thing to do. Versatility, right? Can we kind of test across a range of skills and items and questions and things to do? And then really important is reliability. If I give that same test to the same person under the same circumstances, are they going to perform in a similar manner, right? We really want to make sure that our test, kind of meets those things across the day. And that's one of the problems with like watching somebody work in an emergency department for a week. Like who knows what's going to walk through the door? We might have very different performance if one set of patients walks through the door than if a different set of patients walks through the door. And then the last thing is validity, right? And, does this test really kind of measure the things that we want it to measure? Is this a test that's going to be useful for us? And obviously you want your test, just like your research, right? You want it to be both reliable and valid. You want to be able to use it and feel comfortable making those measurements, especially with the really high stakes tests, right? So when you do stuff with NBME, I mean, they are like geeks about the statistics, and they really kind of beat it into you because, they have thousands of medical students whose promotion decisions or ability to graduate or, likelihood of matching in residency kind of depend on the results of that test. So they really, really, really work hard to make it a good, statistically reliable and valid test. So when you kind of put all those last pieces together, what you come up with is that multiple choice questions really tick a lot of the boxes for much of what we're really trying to do, right? Students are very familiar with them. They're extraordinarily reliable. It's really efficient. You can test a lot of different stuff. They're very accurate when you build a good test. They're relatively objective. There's no performance characteristics of, how did this SPI do today? Did they have a cold and the student got distracted by their sniffles as opposed to paying attention to their chest pain, right? There's all kinds of weird things that can happen. You can sample a really broad class of categories. There are some things that multiple choice questions are not good at, but for the most part, you can really get a big, broad look at your overall curriculum. One of the biggest disadvantages, and this is why we're here today, is it's kind of hard to write good questions. And the performance of your test really depends on how well written the questions are. Writing questions is tough. It takes a lot of time. The tests themselves can take a lot of time. If your questions are not well written, they can really lean towards just, do you know this fact, yes or no? And then there are test-wise students, so students who can really kind of pick up on the right answer whether or not they know the material just based on how the question is written or what things are in the answers when they look at the question itself. So one of the other things is, as we kind of think about this, multiple choice questions really kind of stick down at the bottom of the Bloom pyramid. Ideally, we really want to test students way up at the top of that pyramid, but we can make some good inferences in terms of how they're doing at the top. If they don't have a solid base, they're probably not doing that well at the top either. And so that's, again, part of why we lean so heavily on multiple choice questions. So thinking about stuff in the framework of the Bloom taxonomy, easy questions to write at sort of the base of that pyramid are just to test basic knowledge, right? Can we write a matching question? Can we define this thing? Can you identify that thing? We can also then kind of move up a level on the pyramid and test comprehension, where we give you some facts and we ask you to interpret those facts or explain what's going on based on the information that you've gotten. Or, if these things are all lining up, what's going to happen next, right? So you formulate a theory and then make a prediction based on that theory that you've just formulated. And then, whoops, I went the wrong direction. The last one is kind of application, right? So here's a bunch of information. Can you put all that stuff together, formulate a theory, come up with things, and then kind of use that to decide what's going to happen next or to solve a bigger problem? So we can get, 2-3 levels up the pyramid if we write good multiple choice questions. In terms of question structure, the most common one, what we kind of think of as like the traditional multiple choice question is what's called an A-type question. And if you really want to nerd out about this, the NBME actually publishes, it's called the Red Book, and it's got a graveyard of a bunch of different question types. And it's sort of fascinating to see over the years different things that they've tried. And I have fallen down that rabbit hole a couple times. Like, ooh, I want to write a different question. I want to write an extending matching question, or what they call a K-type question, or we played around with F-sets for a little while. Those are always fun. But it's funny to see, like, I come up with this idea, like, oh, this is going to be a really cool question, and then I look through the red book, and it's like, yeah, we tried that, it's terrible. The statistics are awful on it. But here's an example of what was called a K-type question, right? So you got a bunch of information, you were given a bunch of answer choices, and then it's like, rank these answer choices based on, like, this is a giant mess of a question, right? You're like processing information 8 different ways, and there's so many different ways that you can slip up that it really has almost nothing to do with, do you know the information that they're asking you about? It has, can you navigate the complex logistics of how this question is formulated to get to the right answer? And so, especially as we've paid more and more and more attention to people who are a little neurodivergent, right, and they need testing accommodations, questions like this really throw them off, even if they know the material. So again, we're really trying to stick with what they call the A-type questions. All right, I'm going to pause there for a second and let everybody cleanse their brain palate, take a big deep breath. And now we're going to talk about constructing test items. So one of the first things that you want to start with is what topic? What am I going to write a question about? And here in emergency medicine, we kind of stick with these main 3 things, sort of the mechanisms of disease, right? Why does this patient have this problem? What happened that they have this problem? What sort of, outcomes might this problem cause? Diagnosis. And then management. You could certainly write questions about lots and lots of other things, right? And if you think about the kind of stuff that you saw on step 2 as an example, or step 3, right? There's questions about patient safety and medical legal stuff and EMTALA, right? And systems-based practice. And, I remember when I was just studying for my ABEM exam, my board exam, right? There was a question about how many parking spaces your hospital was supposed to have, and just weird stuff like that, right? But for us in emergency medicine at the clerkship level, we're really just going to kind of focus on this other stuff. You are more than welcome to write questions about, say, EMTALA, but that's not really part of the CDEM curriculum, and it's not something that right now we're expecting students to know. All right. The typical structure of a multiple choice question starts with what's called the STEM, right? That's that big block of text that describes, this is a patient with these sorts of things. And ideally it's a clinical vignette. And we'll talk about what that means in just a second. And then you have the lead-in, which is the actual question of the question, right? Which of the following, what would you expect to happen? What are you going to do next, kind of stuff. And then your options are those 4 or 5 answer choices. Okay, so the anatomy of a question, we're just going to look. Here's a question like this. How many people just broke out in a small sweat? Yeah, What's the right answer? I have no idea. Okay, so the STEM, right, is that stuff at the top. A deficiency in the production of which hormone impairs the production of concentrated urine? Our options are A through E, with C being the correct option, and A, B, D, and E being what's called distractors, right? So plausible but incorrect options. And that plausible part is a really important thing to think about. Okay? When you're writing the STEM, you really want to make sure that you're focusing on just one important concept. Okay? Answer choices get really complicated and convoluted if you're trying to test more than one thing at a time, so really just pick one thing. And it's probably easiest to either find a common problem or maybe a catastrophic clinical problem, right? Something that's really, really, really bad. And we'll talk about that in a second. Okay. Again, we really ideally want to assess the application of knowledge, so not just isolated facts, not just that question about aldosterone, which is a fairly isolated fact, but using that knowledge in some kind of context. And so just sort of coming back really quickly, how might you change this so that instead of just a knowledge question, it actually becomes a little bit more of an application of knowledge? See a lot of blank look. Yeah, this is where it gets hard. So I'll throw something out there. You might paint a clinical vignette, right, in which the patient has a very dilute urine, right? They come in for a test, and essentially their lab stuff looks like diabetes insipidus, right? And now the question, like a deficiency in which hormone caused this clinical condition. So they have to recognize that the patient's urine is dilute, abnormally dilute, and then think about what are the causes of abnormally dilute urine, right? So it's sort of one step beyond just do you know this basic fact. Now you're applying the knowledge of that basic fact. We'll talk more about this. All right, so as you're writing the STEM, you really want to kind of simplify the STEM as much as possible. When I first started writing questions, I would, make them super real life, these people who were all drugged out and couldn't present any information and were half asleep and didn't really want to talk to you anyway, and all they wanted was a turkey sandwich, and by the way, I'm having chest pain, and can I get some clean sauce, and like throwing in all this extra detail that doesn't matter. So you really kind of want to strip it down to the bare essentials of what information they need. You don't want to throw in any intentionally misleading information, and I'm going to put a small asterisk about that. Your patients never lie. You don't necessarily need to use real language for this. And if there are labs, you really want to kind of include what are the normals for labs. And so I know on the NBME, and I'm not sure about the SAEM exam, but they get a sheet of all the normal lab values. And if you're using anything that's not on that sheet, you actually present the information within the STEM of the question, what the normal range is. So again, focus on an important concept. We're going to avoid any negatively phrased stems, right? So that lead-in kind of stuff, we don't want to have, excepts and leasts and nots and all of those sorts of things. Keep out the irrelevant information, and again, I have an asterisk on there. And where irrelevant information becomes important is sometimes it's good to throw in like a pertinent positive or a pertinent negative to sort of help flesh out a differential where you might use that differential as a distractor in your distracting answers. And then watch for really common technical flaws, just grammatical cues, numerical cues, and again, I'll show you some examples of this stuff in a couple of slides here. But in general, your question basically comes out looking like this. A patient of some description is unable to, whatever their problem is, which of the following is likely the injured structure? Right, and so you can already think of a million questions, right? They can't straighten out their elbow after a fall. They can't fully flex their knee after knee replacement surgery. They, right? You can kind of just start filling in the blanks and make questions like this. And so having a couple templates in your head as you sit down to write questions can be really helpful because then you just start filling in those blanks. Okay, here's a slightly more complicated STEM. This would be like a classic clinical vignette. So a patient with whatever background stuff has these symptoms, their past medical history is this, their vitals are that, here's what's on the physical exam, here's some lab results, which you may or may not need to include, and then you might have a different set of lead-in stuff, right? Which of the following is the most appropriate next step, right? That's a nice diagnostic question. The most appropriate treatment, a nice management question. The most likely diagnosis, right? Another diagnostic question. The mechanism of action, the cause of what's happening with this patient. And then you would sit down and write your items. And so that's where, especially like when you're talking about like a diagnosis question or even sometimes a treatment question, right, having a little bit of information. This patient who is short of breath has both COPD and CHF in their background, right? Their lungs are crackly, I don't know, right? And so now you're trying to force the student to sort of suss out, what information leads me down the COPD pathway, what information leads me down the CHF pathway, and decide which of those two is the most likely thing. Or if I'm going to treat this patient, am I treating them for a COPD exacerbation or a CHF exacerbation? All right, so here's what this kind of ultimately ends up looking like, right? A 70-year-old patient is brought in by his family with these symptoms, weakness and numbness. They started suddenly. He's also having trouble talking. Here's some vital signs, right? And so what's being described in this scenario? Yeah, sounds like a stroke, right? So, okay, this guy's having a stroke. Administration, what's the most following next treatment? Okay, well, now I've got a bunch of options for how we treat strokes, right? And then I start to realize, like, oh, hold on a second, like, I'm not just diagnosing a stroke, I'm actually treating it, and some of these things are kind of time dependent and symptom dependent, so let me go back up and say, okay, 20 minutes prior to arrival, so this guy would qualify for TPA, and yeah, this is a pretty bad stroke, so maybe TPA is the right answer, right? And so you can see how you're really sort of forcing the student to process more and more information by adding that extra stuff to the STEM. Okay. It's important when we do this, and especially when we're going to do an exam that's being used at the national level, that we kind of do this very consistently, right? So you don't want questions that are like very obviously written by Tom or myself or something like that. We try to kind of shoehorn all these things into the same thing. And so this is the general order that we're going to have. A presenting complaint with some background information, relevant past medical history, relevant physical exam stuff, and you don't have to emphasize things are normal. Students can safely assume that something is normal unless you say that it's not. And then you may or may not add in diagnostic studies and other stuff, even perhaps some initial treatments. And that initial treatment thing becomes important because a lot of times, this is, when we first started writing for the NBME exam, the correct answer was always give IV fluids. That was always the first step. And they started making fun of us for that. And so we started writing questions that were like, in addition to IV fluids, which of the following would you give? And so again, just kind of looking for little things like that can, change up your question and what you're asking are important. All right, so now we're to the lead-in, right? That was all just about the STEM, that big chunk of information that the student's going to tap into to actually solve the questions. So the lead-in, it's important that we phrase a clear question, right? That everybody understands what we're asking and what they're supposed to answer. Again, we really, really, really want to avoid any kind of negative phrasing. So we're not using the except, least, not stuff anymore. And then watch out for the technical flaws, stuff where you have a grammatical answer where only one of the correct answer choices works grammatically or works numerically for that answer. And then answering the question really needs to require some piece of information pulled out of the STEM, right? Otherwise, it's just a basic recall question. You can throw out the entire STEM and just ask, which hormone makes urine more dilute, right? And so there's no point in reading through 4 or 5 sentences of a STEM if you can answer the question without even reading any of that. And so that's why it's important to have that skill of like, let me look at this question and think, how can I reframe that into a clinical vignette? All right, so some sample lead-ins would be something like this, right? Which of the following is abnormal? What's the most likely finding, the most likely cause, the next step in management, the most likely pathogen, the underlying abnormality, right? You can kind of think of all of these. And I'm going to send you a link. At the end of this, I have a QR code, for the NBME's Red Book. And they actually have, it's like, 6 or 8 pages of lead-ins. So if you're asking about management, here's a page and a half of lead-ins that suggest management. Here's a page of lead-ins that suggest diagnosis, which is really helpful sometimes when you're feeling stumped. Okay, like we said before, we really kind of want to make sure that we're testing application of knowledge, so not just knowledge itself, but those couple steps higher on the Bloom pyramid, where we're asking them to sort of, here's some patient stuff, can you synthesize this, kind of formulate a differential, and then sort of think through it in almost an if-then pathway, right? So if they have these findings, then I know they have CHF, and I will give them this information. And then, we can sort of predict their clinical course or maybe select what's our course of management. All right, so that's our question and our STEM, and then we're going to move on to distractors. And in my experience, writing 3 or 4 plausible but wrong distractors is the hardest part of all of this. I can write a great question, have this awesome lead in, and I'm like, okay, here's answer 1, that's a correct answer. Here's answer 2, which is obviously incorrect. And then I'm like, crap, I don't know what else to add here. So it's also important that your distractors sort of look the same on the page, and that they really ideally differ along what we call a single dimension, right? So, if you have 4 treatments and a therapy, that therapy really that's the same thing. 4 diagnostic tests and a treatment, right? That one thing kind of stands out from the rest, and it's either clearly the correct answer or easy to cross off as a wrong answer while you suss through the other ones. So ideally, you kind of move things all the way along. If you really can't make them all the same, one trick is to start pairing things up, right? So maybe you have like 3 treatments and 3 diagnostic tests or something like that, so that students are sort of stuck choosing, well, number 1, do I want to go down the treatment route, or do I need more diagnosis before I can treat? And then, now that I've decided on a pathway, which of those is the best answer in that pathway? So again, it's usually pretty easy to narrow down the options to 2 choices. That's fairly common, and don't feel bad if that's the best that you can do. It's important to look back and make sure that you have stuff in your STEM that eliminates any wrong answers, right? So that the student can come back and be like, why is this one wrong, right? The wrong answers need to be clearly wrong. You might have answers that are incorrect, but not wrong, right? And so sort of thinking back to that stroke one, right? Like pretty much all of those options were correct options. They just weren't the best option, right? And given those symptoms in that time frame, the best option would be TPA. But you could certainly give that patient, heparin or clopidogrel or whatever. And then it's also important that you make sure that whatever alternatives you have don't overlap. And we often get into trouble with these with like antibiotic questions where it's like, well, you could give, that's kind of a second line therapy, but and so it's important that the differences between each answer are very clear and that they don't overlap at all. One of the things that I like to do is sort of think about, when students are presenting this case to me, what are things that they mess up? Right? What are the common errors that they make, and then I'll make those one of my distractors. Another one is sort of stuff that sounds familiar but is wrong. And especially if it's a little bit, it sounds kind of highfalutin, as I like to call it, where it's like, oh, that sounds fancy. I don't really know what that means, but that probably is the right answer because it sounds good. Or a true statement that doesn't actually answer the question, right, is kind of a similar thing. You really want to avoid the humorous or very clearly wrong distractors. This slide, it's hard to read this slide, but I moonlight from time to time at the VA, and this was from one of my required hospital modules at the VA. And so I wrote it out, and the STEM, the lead in here, the four components of customer service, right? I don't need any other information to answer that question. So we want to avoid stuff like this, right? Where it's like, okay, this is really pretty easy to figure out what the right answer is. So the last thing about the distractors, and this starts to kind of get into test analysis stuff, is ideally everybody's picking one of those answers, or somebody is picking one of those answers. Every answer is getting picked by at least one student. If somebody's not picking it, then it's not a good distractor, right? The best ones are the students who are performing poorly choose that answer, and the students who are performing well choose the right answer. Okay? If you start to see a mix of that, and again, we'll talk about kind of the testing statistics and how you figure this out, but as you start to see a mix of that, you kind of start worrying about the question, and maybe you need to kind of mix up your distractors or revise something or add some information to the STEM or even just throw out the question entirely. All right, so putting everything together, this is sort of what a test question ought to look like, right? It should just have this nice big long stem. Here's a bunch of information. If it's a really short stem, it's probably just a recall situation, right? And then relatively short options that are pretty much all the same length, okay? So looking for some flaws in questions. Here's a question. Anybody spot the flaws here? Flaw. 2 flaws at least.
Options are all different types of things.
Okay, options are all different.
Grammatically, it doesn't make sense.
Yeah, grammatically, that's kind of a problem, right? And I can't really administer a CT scan of the head or an ethanol level, so immediately the test-wise student can cross those off. And then kind of a secondary problem is I don't know that naloxone, and glucose are a wrong answer here. Right, so I would sort of do both of those, but I guess with administration, I gotta pick Narcan, right? So watch for those grammatical cues that change. So how might you change this to make it work?
Put the pupils and then say, what is the next best step again?
Yeah, right, that would work. And then you might have to add some verbs here, right? Check a finger stick glucose, obtain a CT of the head, measure an ethanol level, right? Stuff like that. But so if you could easily fix the grammar, and then I agree, right? Throw something else, some other piece of information in there that either pushes you towards the Narcan or pushes you towards checking a finger stick. Good. So here's how somebody fixed this, right? They said, which of the following is the next appropriate most step? Exactly what you said here. So now they're all diagnostic tests. We added a 5th item in there just to kind of throw things off a little bit. And now there's no treatments in there. Narcan is no longer an option. These are all diagnostics. All right, here's another one. What's wrong with this one?
Different lengths, different kinds.
Okay, so we got different stuff going on here. There's another big problem with this answer set.
A through C are mutually exclusive.
Yeah, right? It cannot do all of those things. So you kind of get stuck in this little subset of like, well, it's got to be one of those three, and I can sort of ignore the other two because, you know, we've covered the entire range of options in a subset of the answer. So you got to watch out for stuff like that. All right, how about another one? This is a classic one. It's the title of this lecture.
The word's never.
Yeah, so watch out for those absolute terms, right? They never do this. They always, right? Because there's almost always exceptions to those rules, right? So watch out for any of those, you know, totally absolutes. All right, how about this one?
Always C.
You're close. C is the answer. But right, it's the longest one, right? So having this one answer that's like the really like beautifully written, like perfect answer, and everything else is kind of meh, meh, meh. You know, that also often makes it obvious that the correct answer is that answer. And that's why it's important to kind of have all your answers at similar length. All right? How about another one?
This is kind of obvious, like
What, go ahead, explain
like
that.
the experiencing the world is unreal, and then that's in the. Like,
Yeah. Anybody in here do the Duolingo? So I've been learning Duolingo Spanish, and I have realized, like, oh, that word is, like, I don't know what the word means, but it's in two places, so it's got to be the right answer. I've gotten really good at cheating at Duolingo. I don't know that I'm learning Spanish, but I got a lot of answers right. All right, here's another one.
Like several right answers for that.
So yeah, you're on the right path, right? So there's a bunch of answers that include vancomycin, and so you're kind of like, all right, it's probably vanc, and now which other thing do I need here, right? So this is sort of like that same as like we've covered all the options. You know, if there's any way that a student can sort of cross one or two of the choices off, that makes the question far easier for them. And then the test-wise student is going to do better, right? Just by random guessing alone, they're going to do better than the student who doesn't recognize these sorts of things. Okay, so stuff to watch out for, some pitfalls, right? Watch for really long or complicated options. Be careful about numeric data. You know, if you have one thing that has decimal points and another thing that doesn't, or stuff like that. Be really careful with frequency terms, which are extraordinarily vague, right? So rarely or usually or often, stuff like that. I know when I'm writing items, the NBME, that's probably the most common one that I get stuff back is, you know, they're like, no, we need a specific number. You know, if I say the patient has had symptoms for 2 days or a few days, they're like, how many days? How many hours? How long did it take to get to the hospital? Make sure that your options are not in some weird order. We don't ever use none of the above or all of the above. And again, watch out for kind of the tricky or complicated stems in all of this. So, you know, sort of getting back to this giant mess, right? Like, good Lord. So some other problems with this are, you know, we have both regular numbers and Roman numerals, right? We've got letters and numbers and negatives and positives. And like, this is, I mean, even without the question itself, like this is just a giant mess without even considering the material being tested in all of this. So we want to avoid writing questions like that.
I would just guess in med school on that question because I like this gives me too much anxiety.
Yeah, right, exactly, right. It's like, see, next question, I'm done.
No, where's my
Yeah, exactly. All right, so now let's kind of practice sort of elevating things like we did a little bit, right? So here's sort of a knowledge level question, right? What's the blood supply to these parts of the brain, right? Do you know this anatomy? Yes or no is all this question is asking. And so you might take a question like this and kind of move it up a level, right? So now we kind of have, here's some symptoms, and we know that the symptoms are causing problems in a certain part of the brain, right? The right upper extremity more so than the right lower extremity. He's also having dysarthria, but no other cranial nerves, right? So now you have to sort of put that into a knowledge of neuroanatomy, which parts of the brain do that, and then which parts of the brain are supplied by which parts of this arteries, right? So the ultimate question is really the exact same question, but how you get to asking that question is very different. Right? And we could even take that up another level, right? And now add in this kind of stuff of, you have to diagnose that this guy has a stroke, you have to diagnose that this guy has a stroke that's amenable to being treated with TPA, and that he's got the time frame of TPA, right? So we're looking at a very different question now. But the information being tested is sort of overlaps with that, right? And so now this gets back to what we were talking about way back at the beginning in terms of what are the things that I really want my students to know. And I would argue, in the emergency department, do I really care about this? No. Do I really care about this? Absolutely, right? So I don't care if a student knows which blood vessel is involved. What I want to know is, do you recognize that this patient needs TPA and that patient doesn't? And so that's kind of how we can get to all of this stuff. All right, I'm going to pause there for questions.
Just a more logistics question. When you're writing questions, do they want you, when you submit the questions, to sort of submit like how long it take to read the question stem as part of like the question's like data that goes with it?
That is often part of the review process. So as we're going through questions, like, wow, this is a really long question. Can we pare this back at all?
Okay. That's why I was curious if there was like guidelines and limits that they would set, or if they asked for a certain combination of shorter ones, recall ones, and the longer question stem.
So one of the things that I do is I'll write questions in batches and then kind of set them aside for a little bit while I work on the next batch, and then I'll come back and kind of reread them, and that's when you're like, oh, yeah, oh, man, we got to shorten that one. Because in the moment, you're like, oh, but you got to have this, and you need to know that, and here's some background stuff. I think that's one of the other hard parts about writing questions is you often have this very specific scenario in your brain, and it's totally clear to you, like, what's happening in the question. And that's why, having other people look at your questions can be so useful, because they're like, I have no idea what you're asking about right now. I think, yeah, you had a hand up.
One question is about kind of negative lead-ins. I was hoping that, like, Dunn and all could talk, because every time I kind of looked into that, they're like, well, it's confusing for people if you say a negative thing. But, like, I feel like for me, when I take questions like this, those are actually the more cognitively, like, difficult ones, and it's not because I'm confused, it's because, like, that actually adds a layer of like thinking to it. So I'm just confused as to why, like, if you bolded like accept or never, you put that in bold and underlines, how that doesn't just overcome the problem with writing a negative lead-in and give you a more difficult or better question.
So what that often does is it basically punts it back into the just basic knowledge realm, right? Because essentially you're looking at each of those answers and deciding, is this answer true or false? And it's really, really hard to make a diagnostic thing or a therapeutic thing where you have four, plausible but incorrect actions, if that makes sense. And so you end up just really down at that basic knowledge level. But the other piece of it is, like I was saying, with, sort of, people who are not neurotypical, like, they just have trouble processing the information that way, and we're really trying to make sure that tests are fair across the spectrum of test takers.
And then with that same thought in mind, how does none of the above not add like, why is that one avoided in terms of, like, if you have a bunch of answers and you leave none of the above as an answer, that seems to also, again, give everyone an out as an option that it may be none of these things and make it more difficult.
That's a great question, and I've often wondered that. I just know that's an NBME policy, is we don't use none of the above. When I took physics in college, our physics instructor, all the test questions were worth 5 points. There were 4 correct answers, and then the 5th answer was always, I don't know, please just give me 1 point. So it's like, basically like, I'm not gonna let you guess, or if you're gonna guess, just take the easy single point, and it statistically washes out in the bath.
All of the above makes sense, right? Because then if you can name 2 of them, then you already know.
Exactly.
Seems like something that would add a little bit of complexity. My last question is about language, because things have kind of changed a lot in this year. How do you decide what terms to use in your STEM? So for example, I saw chief complaint up there. Some people would say chief concern. There's psychogenic non-epileptic seizures, there's pseudo-seizures, there's functional seizures, there's AMA, there's self-directed discharge. How do you decide, like, and you can't write all of them, right? Like if there's like 3, how do you decide, like, putting a new term in there that people may not be familiar with that they learned in medical school versus making it more confusing, which is kind of something I think.
So again, that's sort of the editorial process. The NBME actually has a style guide, and that will come up every now and then of like, you know, we all know what we're talking about, but how does the NBME want us to phrase this particular thing, right? Like AMA versus self-directed discharge. I think that's a great example because I seem to be seeing that more and more and more now. I still use AMA, but a lot of my residents are using self-directed discharge. But so, you know, when you bring your questions up, right, and you go through them in a room like this, if half the room is like, I don't know what that phrase means, like, that's probably, maybe we need to go back to a more common usage. And that, I mean, that's the other fun thing about being at that NBME, and Tom and Deep are kind of nodding their heads here. But, you know, sometimes you're like, you don't do this thing at your hospital? So again, it's important that we kind of get a broad cross-section of input to the questions. And, you know, if we're going to use this exam nationally, the questions need to be understandable and applicable at a national level. Right, so for you, who's going to write stuff for the disaster fellowship, like that's going to be an important consideration because disasters somewhere in Arctic Alaska may look very different than disasters in rural Arizona. And so, you know, are there broad principles that are being tested that way, or do you have to add that context of, in Alaska, this situation happened, what would you do? Other questions? I thought I saw someone else with a hand up. No? Okay.
How do you know where to put the correct one, A, B, C, D, E? So it's not like all A's, all B's, all C's, all D's, all E's.
Yeah, so the way that that's generally handled is you always order your option set alphabetically. So your first option is always, you know, at the front of the alphabet, next letter, next letter, next letter, next letter, and then that will just actually randomize things. I know occasionally when we're writing questions, sometimes you get like, man, that was 7 C's in a row or whatever. And so we'll occasionally change the wording of the answer choice so that it kind of shuffles out a little bit. But if you're doing your testing correctly, if you have a big item bank and you're really analyzing your test and how it performs, it doesn't matter. You know, you could have 15, you know, C is the correct answers in a row, and it makes no difference.
No freaky student out.
Yeah, exactly. So, right, it can't possibly be C because the last 10 were C. Yeah, so either they know the information or not. Other questions?
It seemed like one of your approaches here was to start with the end question in mind and then redesign STEM to fit the end question that you had. So rather than you have like a basic knowledge question and then you elevate it to become an application question. Does that seem like a...
Yes, that is definitely a good approach. I will say in general, I think kind of starting with like what am I really trying to test is the first thing, right? And so I might be like, hey, I want to test, you know, do students understand when the time frame for giving TPA? Right, like that's really what I'm trying to test. But part of that is like, do they also understand that, you know, which patients need TPA or not? Because if they're like, well, this guy's headache started 90 minutes ago, I'm giving him TPA. It's like, whoa, hold on a second, right? So, you know, that might be my testing point. And then, okay, what information does a student need to be able to answer that? But I often actually start with that question and then start thinking about distractors, because if I can't come up with a good lead-in and the distractors, like I could write the best STEM in the world and I still can't make that question work. You know, and so like we are at times tasked with writing like ethical questions for the NBME, and you know, and like ethical questions to me sort of become very binary. Like it's either this is the right thing to do or this is not the right thing to do, and so to come up with like 5 options that are like could be the right thing to do, but not in this case, like I just find that impossible. And so it gets really, really, really hard to write questions in that vein, but some people excel at it. Other questions, comments? All right, then let's move into this last kind of chunk, and then we're going to take a little break, and then we will start looking at a bunch of questions. So In terms of your test analysis and your item analysis, the test analysis obviously is just sort of the big picture, right? How many students met my passing threshold, how many students did not meet my passing threshold, how many questions on average are they getting correct, and those statistics I feel like we're all pretty familiar with, so I'm not really going to get into that. There are whole processes for how do you decide what a passing score should be, and that's really at like the medical student or national board medical school or national board level. But when you administer a test, if you have good testing software, it should be able to give you a range of basic statistics. And you can crunch all this stuff out on an Excel sheet if you really want to. It takes a hell of a lot longer. And so one of the things, if you're ever involved with the purchasing of testing software, I would ask a couple questions of like, what statistics does this actually spit out for me? And ideally, you get kind of an item report that includes what's called discrimination. So how well does this one single question separate students who know what's going on from students who don't? And then just a sense of difficulty. How many students got this question right or wrong? At the individual level. And then there's another thing called the KRR score that's for internal reliability, just essentially like how is this test performing as a test overall? Are students doing kind of like we expect them to do? The difficulty of a question is classed, unfortunately, as a p-value, which is not the same p-value as when we're talking about research papers, but it's essentially how many people got this right, questions that have a p of greater than 0.9, so only 10% of the students are getting, 10% of your test takers are getting the question wrong. That's too easy, and somewhere less than about 0.2 is too hard. Ideally, you really wanted it around the 50% range. You have a little bit of a range there, but 50% really seems to do well in terms of maximizing your high and low achiever discrimination. And so when we kind of look at this, where these numbers, why we want to do 5 and 4 responses is if you look at how the item difficulty varies based on how many options you offer, the sweet spot really happens to be in that kind of 4 to 5% range. And so this is basically, it's a weird statistical calculation that's essentially, if the student were to guess versus if the student, if 100% of the students got the question correct, I forget the exact formula for this, but basically that's how that plays out. And so we really want to write questions that have 4 or ideally 5 responses to kind of maximize that. The discrimination index, again, the formula for this is relatively simple. So it's just the number of students in the top quartile who got the question correct minus the number of students who in the bottom quartile who got the question correct. And it has a range from -1 to 1. Anything in a positive range means it's doing a good job discriminating questions or discriminating students. The closer you get to 1, the better that question is. Anything in the negative range is actually wrong, right? It's doing it backwards. So what that means is poor test takers, students who don't know the material as well, are actually doing better on that question than good test takers, the people who do know the material well. Okay, and so putting all of that together, I know it's a lot of mumbo jumbo, but so when you get a test report, it will look something like this, right? So here's a question on the test. Answer A is keyed as the correct answer. About half the students got it right. Fantastic, that's right in that 0.5 range where we want it to be. Our discrimination is 0.27. Right? It's not great, right? That's kind of close to 0. It's a little closer to 0 than it is to 1. So it could do a better job of discriminating. And so if I really wanted to kind of do something with that information, what I notice is answer B is getting a lot of love. Right? And so I don't know if, maybe there's something that test takers like the smart kids know that sort of pushes them towards answer B. Or if there's something else about answer B that makes it especially attractive. So one of the things that I can do is go back in the test, look at that question, look at the answer choices, and look at answer B specifically and like, oh yeah, I could see why you might think that's the right answer. Let me tweak that a little bit, or let me add some information to the STEM. Or maybe it's a perfectly written question and you need to change up your teaching style a little bit, right? And kind of harp a little bit more on whatever the difference is between answer A and answer B. Right? So just like as an example I could think of, right, like this unresponsive 18-year-old question, right? Somebody said, oh, if you added information in about the pupils, right? Maybe the initial version of the question didn't have anything about the pupils, right? And so Narcan becomes this really, really likely thing, whereas if you added that information, right, this patient has big pupils or something like that, that makes glucose a more correct answer and makes your question perform a little better. Okay? All right, here's another one. What do you guys think about this question?
Discrimination index is concerning.
Yeah, right? It's a negative. Just right. We got to throw this question out or figure out what the hell is going on. So again, same thing, right? Answer C is the correct answer. A lot of students are picking that. But knowing that the discrimination is negative, I know that the high-performing students are choosing answer B. And so I got to do the same analysis and kind of sit down and be like, what is happening with answer B? Why are people really, really, really picking that answer? And kind of go from there to make some changes. So good. And oftentimes what that is this kind of gets into, right, the difference, and I'm sure you guys do this in your clinical arena all the time, right? On your boards, this is the correct answer. But here today, we're going to do this other thing. But on your boards, this is the correct answer. So the other thing about this is, your discrimination index and your overall difficulty should really kind of increase until you get up to that, 0.8, 0.9 in terms of difficulty, right? So essentially, the hardest questions are the one where your best students are the only ones getting those questions right. Okay? If you have a really easy question, it often doesn't discriminate because everybody gets it right. And a ridiculously hard question doesn't necessarily discriminate because everybody gets it wrong, right? That's why you want that kind of range of difficulties. But again, if you have an item that isn't performing well, it's a really hard question and it's not discriminating, just get rid of it. Students are sitting there racking their brain out, and you as a test administrator are getting no valuable information from that question because it's not discriminating the way that you want to discriminate. All right, so in terms of the life cycle of a multiple choice question, what basically happens is people write questions, the questions get folded into an examination, you get those item analysis, and you get back to you, and then you edit some questions, and I have a handful of questions that Juana has shot to me from the most recent exam administrations that need to be fixed up. Things that are doing well get added to an item bank, and then things that are not doing well either get revised and retested or just thrown out completely because we've written a bunch of new questions. And then ideally, as your bank grows, you start adding forms to your exam, and that's something that we would like to do with the SAEM exam, right? Right now we have version 1 and version 2. It would be great to have a version 3 and version 4, so that as students take the exam, it's not every student taking the same form of the exam all at the same time in the same big room or whatever. So that just helps with things like exam security and stuff like that. All right, last questions about this.
So again, I'll preface this, like I'm not on the NBV side of things, I focus on EMS questions. Sometimes I grapple with this idea about like, what is the purpose of an exam? And sometimes it's to ensure, like more so like on the initial education or the UME side of things. In theory, if something was taught well, I wouldn't have a problem with the majority of students getting that item correctly, which I would understand more on like a board exam. There is some like discrimination of abilities. How do you grapple with that?
So I think what you're asking is testing for competence versus testing to sort people out. Yeah, I mean, that gets into essentially like choosing what your passing thresholds are, right? Because you want all of your students to meet some minimum passing threshold. And so there you just might make your exam pass-fail, right? Just like step 1 is, where you just say, okay, I need all the paramedic students to get a 62% on this exam or higher. If they're not at that point, they got to go back to class. And if they are at that, I don't care if they got a 99 or a 63, they know as much as I would like them to know. And so that also kind of depends on your overall blueprint, right? You essentially want them to, either do really strong in most areas and they can miss a couple of areas, or kind of average knowledge across the board in all of the areas. So, I mean, that's you're kind of getting into sort of philosophical questions of test construction in general, which are for you to decide as an instructor, what am I really trying to do with this exam?
And part of the reason I'm asking is, as I have drifted more towards guiding these statistics about what items I include in our program's exams, although I'm more satisfied statistically with like, these are all great items, I'm seeing their scores are dropping because the exam is just getting proportionally counted.
Okay.
So that's what I'm grabbing.
Yeah. I'm not sure what I'm trying to answer at this point. Sorry.
Yeah, that wasn't necessarily a question.
Okay.
I'm putting it out there.
Yeah. Yeah, I think another way to think about that too, right, is like, okay, maybe you put your exam in sections. There's a cardiology section, a physiology, respiratory, whatever, and they have to hit some minimum passing score in each section as opposed to an overall passing score for the entire exam, right? So it's like they know two things really, really, really well, but they don't know anything about these other things, right? Because again, you're trying to test for like competency as opposed to rank all of your students from best to worst.
Well, if you are confident that you have good test questions and you're happy with them from content and discrimination index, and you have a competency threshold that you're at, if people aren't passing it, then I mean that's what you decided is the competency threshold. That's the difference between like grading on a curve versus having a competency threshold. That's less with the items. Again, if you're confident that you have good items in there that are assessing the content you want and have good discrimination, and people are just not passing as much, which I think many of us have probably seen some of that happen more recently, is the kind of quality of that that's happening. I think that's less to do with the items and more to do with whether you're accepting that competency threshold that you said is actually the right number, which it may be, and may just be that less people are able to pass it.
And I think where I am is, because like me and my medical director, we talked about this, like this is his background. So for him, if there's an item where too many people are getting correct, the reflex for him is we should get rid of it, it's not informative for us. Whereas I'm coming from a slightly different perspective about like, no, this is actually serving a purpose for us, which is maybe just like a difference of the context in which an item is being used.
Yeah, these are good things to think about. You certainly don't want to ever be in a position where it's just like, it's test day, this is the test that we always use, good luck, right? And you're not really thinking about why are we testing, what are we testing for, what are we really looking for. But I don't know that there's necessarily a right answer to the questions that you're asking, right? They're just sort of things to think about as part of your overall educational strategy. All right, if everyone wants to take 5 minutes, there's bathrooms sort of back, like straight back through the glass partition. There's water over here. They were supposed to be bringing us coffee, but I'm going to put up a Google document here in a second that has a big QR code on it so that you guys can all go to the same shared document, and we'll go from there.
What's that? Were you able to get, can you see the QR code, or can we send it to you?
Yeah, I can see it. It's not, when I just pull it up on my screen, it's not clear. I'm just to scan it.
Okay.
Let me, hold on, I'll email the link to the document to you.
Cool.
And
I got the PowerPoint, so that worked perfect.
good. I want to do one example question that we'll do as like a big group. And then we'll have like one group start at question 1 and just do like 1 to 20. And the second group will start at like 21 and do like 21 to 40. And that way we should get more questions. I see people on the document, so that's good. I'm working on my
it's a cool talk, and it's giving me a lot of ideas for how to update the bot,
Good, good.
things that we can play around with.
Fantastic.
curriculum. You see it?
There, I think this is Tom. Somebody's plugged in over here.
I know, that's the only one I saw.
Yeah, I guess because they never put them on these divider walls, and all the other walls are divider walls. So yeah, that sucks.
It's okay. I have enough for good.
There's another power strip under here.
Charge it for a minute.
I don't know if I can. Well, I was gonna. No, it's all taped down. I was gonna like disentangle it and pull it over that way, but. One of the guys I work with has started bringing like a power strip, like a 30-foot extension cord everywhere he goes, and I'm like, I need to start doing that.
I know. I'm gonna leave it on top of this rat's nest for a minute while you do the group stuff.
For Juana's, for next year, like, it would be good to have some. Let's have two people from this table move to here, and two people move to there. We're just going to split up into two groups. And then Eve, why don't we go back there, and I'll stay up here, and Tom and Sarah, you guys go wherever. So basically, two tables kind of one in each corner, so the noise isn't carried over. We're going to kind of we'll do like a question or two as a big group and kind of workshop this a little bit, and then we'll sort of split up. And we'll have, this group will do the first 20 questions, and that group will do questions 21 through 40 when we split up. I don't know, can everybody read the screen here? And you can just add it directly on the Google document, make notes and changes and comments and however you want to do it. But so, first of all, does everybody have the Google Doc? Everybody had access to it? Anybody have problems with that? Nope. I can also email you a link if you need.
So like do it on your phone and then go to Google Drive on your computer, go to share it or later. Yeah.
Say that again for the room.
I can also airdrop.
Scan it with your phone, go to Google Drive and look for shared, you said?
Yeah.
Oh, nice. Okay. Kim, we're splitting up into two groups. You can pick whichever one. We got 1, 2, 3, 4, 5, 6. Why don't you sit back there, and I'll sit up here. All right, now is everybody on the Google Doc? I hope. Cool. All right, so this first question, I got it here as examples. A 55-year-old male, past medical history, diabetes, vision loss in his right eye, also describes it to be painful, left eye unaffected. Which of the following is the most likely diagnosis? So my first problem with this question is we don't have eye stuff on the CDEM curriculum. That's kind of a problem. But as I think about that, I don't want to just throw the question away outright. So my first thought is, glaucoma often presents with somebody said it, headache, right? Are headaches on CDEM curriculum? Oh, okay. So maybe we could change this into like a headache question where glaucoma is the right answer, because things that are the differential or in the differential for stuff on CDM curriculum are fair game to be asked about, right? We expect our students to understand differentials. We don't, they should know that glaucoma is part of the differential for a headache, and they should kind of know the basics of glaucoma. So that might be one thing that I would do to fix this question up. Another thing that I noticed, right, is it's missing kind of all of those typical details that we talked about, right? We have a person with a complaint, and that's about it, right? So there's no, I guess they gave us past medical history of diabetes, but there's no vital signs, there's really no physical exam stuff, I don't think, right? So we need to add that stuff. And one example that I make why that stuff is so important, right? It makes the question longer and it's not necessarily relevant to the question, but do you guys know the concept of Chekhov's gun? Right, of like if you're writing a play and there's a gun in the first act, you know it's going to show up in the third act. And I think this is sort of the antithesis of that, right? That if you normally don't have a piece of information in a question and then suddenly it's there, it becomes really important. And the example that I will give for headaches, right? Here's a question. A patient presents with a headache, blah, 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 blah. What's the most likely cause? And now I'm going to change that question slightly. A patient presents with a headache in Chicago in January, blah, 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 blah. What's the most likely cause? Everybody. Carbon, right? So, just adding that little information, we see that all the time, unfortunately, and it would be lovely to add what month and what city every patient was in, but that's probably too much, right? But same thing with like heat stroke, right? Where it's like the elderly patient is found altered by the way they live in Atlanta, and it's been 106 this week. So, that's why we always want to have stuff like vital signs and sort of, basic relevant physical exam kind of information so that when that information is presented, it doesn't suddenly jump out because it wasn't typically there, right? So if every question was written like this and then all of a sudden we added vital signs to the question, students would know, oh, the vital signs are the key part of this question, if that makes sense. All right, so, we don't have to do this particular one, but I just want to give an idea with that. So what I might change this to is like a 55-year-old, well, let's do this as a group. So 55-year-old male, past medical history of diabetes. And so one question, do you want to give him a history of glaucoma? Like how do we expect students, like, am I thinking about, do they recognize physical findings that are concerning for glaucoma, or do I just want them to know that glaucoma is on the differential for a headache? And there's no right answer to that question. I don't know what you guys would prefer to write this as.
How often is retinal detachment, retinal occlusion, or retinal vein occlusion bilateral?
That's a great question. Not very.
But glaucoma is.
Okay, true. Good point there. But so back to my original question, at the fourth year medical, right, because this is kind of like a ITE level question, right? This is really a resident level question in my opinion. But at the fourth year medical student level, how much do you guys, let me even take that one step back further. How many of you guys even have ophthalmology in your medical school curriculum at all, period? One. We had it where I went to med school, 2, 3, 4. Yeah, exactly. So 4 people out of this room, which I would like to think is a representative cross-section of educators in emergency medicine, have ophthalmology in the curriculum. So I would say recognizing findings of glaucoma are probably beyond the knowledge base of what is expected of the average fourth-year medical student in emergency medicine. Does anybody disagree with that statement after hearing that? Right? So I think to give this guy a history of glaucoma is probably fair. And now we're going to have him present with a headache. And vision loss in his right eye. And let's say with right eye pain. I don't know if that's just making it too obvious.
I don't think I know anybody who wouldn't get glaucoma. Yeah.
Yeah, I might even express, but I might go to.
So did I make it too easy is what you're saying? Okay.
I might go to treatments then, if you were expanding and giving 4 treatment options instead of, and some of them might be, TPA might be one of the treatment options that you put in there for.
Okay. Well, so maybe we take this back out.
Yes, that makes it.
Could you jump to like a next step and like one would be like check an ESR, so like some temporal arteritis.
Ooh, okay, okay.
And then like another one would be like console ophthalmology. I don't know, maybe eyes. I don't know if we can work, if putting the eye exam makes sense.
So I'm just going to make some little notes here, right? So I could see like ESR.
Or how about this, which of the following will give you the diagnosis? And then you do things like ESR, fluorescein exam, intraocular pressure.
Yeah, that's kind of where I was going too. So what are some other sort of eye pain, headachy things that they might test? Oh, okay. Oh yeah, ocular ultrasound. Or maybe like fundoscopy.
I think I would probably just say the patient has a headache and vision, and decreased vision, and then I would give like an actual visual acuity to figure out that it's lateral versus bilateral.
I like that a lot.
Let them sort that out from a more robust physical exam within the STEM.
Okay.
And that way you have a wider differential of both headache and eye complaints to play with your question.
That's a fantastic suggestion. So like a vision exam where we have like a VA and the right eye is like 2200 and the left eye is like 2030 or something like that, right? And then maybe the right eye is a little injected and the pupil is fixed. Something like that.
And then that way you could actually probably use similar stems and ask both what's the workup, what's the treatment, or what's the most likely diagnosis. You probably look up all of that.
So then instead of which is the most likely diagnosis, which let's see, most likely to show the diagnosis, right?
Which of the following diagnostic tests reveal the diagnosis?
Yeah. So something like that. Right, and then to your point about treatments, I think that would also be a fantastic, right? That makes it like a next order question, right? So you have to sort of figure out that this is glaucoma, and then remember what are the appropriate treatments for glaucoma. But going all the way back to where we started, like I don't know that I would expect a fourth-year medical student to know that, but I feel like a question like this, right? Do you recognize that glaucoma is part of the thing, that it means elevated ocular pressures, and that's the test that you really need to kind of figure out glaucoma, right? Because an MRI or a SED rate probably not going to help in this particular case, certainly not an ocular ultrasound. And I don't know if my student can diagnose this by fundoscopy, more power to them. So you see kind of how this process works, right? And this is why it's great when it's a group process and we can kind of really work through these things together, because different people have different ideas that suddenly turn a okay question and they're like, wow, that's a solid question. Like I would use that on an exam. What do you guys feel about that? Obviously it's not a totally final product, but how do you feel about, where we got with this question? Okay, everybody understand the process and what our goal is here today?
If we're doing this, should we do suggestions or just go ahead and edit right out the document?
Just go ahead and edit right on the document, and I will turn this into finalized questions when we get there. So like I said, this group will start at question 1 and just go through question 1 through 20. Was that right? 1 through 20. And then, and then you guys will go 21 through 40, right? I'm having trouble with inclusive versus exclusive, sorry.
If you want to edit it, can you open it up so we're on there?
Oh, do you not have editing access? I am.
Edit access, which I tried, but you're going to get 20 or 15 of us asking.
Anyone who has the link can access, no sign-in required. Right. All right, see if you can edit now. Sorry, I apologize for that. I see cursors on there. Cool. So, maybe like appoint one person at your table to kind of be the note taker so we don't have 63 people on that document all at once. And then actually, I hate to do this. Can we move this table here? So Michael is participating via Zoom and wants to listen in, and I think it would be better if he's at We're all at the same table.
You can probably just move.
Well, it's plugged in, and there are no plugs in
The
it.
microphone is here.
Oh, okay.
Put it over here.
Oh, I thought this was the microphone.
No. So he should be able to hear, and then I'll.
Is it okay if you can't, you're following along on the Google Docs?
Want me to just join him on?
Let's say we could point in this direction so you can see everything. I don't know if that helps, but
You can see the mess that is.
yeah, I don't know, because you can see how the Google Doc here. But
Okay.
all right.
And then I apologize to this table, but I may eat while we're doing this. I'm on Seattle time, and when I got here at 9 a.m. my time, I wasn't really hungry. I got ready.
It's right on this one. It's funny long.
Can you hear okay, Michael?
Yeah, so I was already.
Oh, you are listening to the table you're staring at. And so we're doing questions 1 through 20.
Cool.
What's this last note about?
Oh, that's, oh, that, I got it, okay.
Yeah, I can barely see it. That's just stuff.
Well, you know, also.
Of course, that's the answer. choice.
My only problem with this is
I think
the
there's
center little
obvious,
wall.
like,
It's very long.
So,
There's
but
not many-
how do you get all of the
There's not
information?
But you probably don't need like this year AFib and then also the, heart rate is regular, like.
And only because you're gonna think about the contribution of being on the anticoagulants. So it's like a CI.
It's the most, like, the most distracting.
Yeah, and then I mean.
Well, so this one, like all the way back, it's funny,
Seizures, if you want.
things, right? Hypertension, hypertension, atrial fibrillation, not currently taking anticoagulation. You might even just say that, right? Takes no medication. It's like CBC. But I think that whole sentence is right before it's produced in the sort of use the lead out, right? So that's applied by the sudden onset of these things. Sure, yeah. And then, we often kind of summarize the vital signs together, right? So on arrival, BP 168 over 92, HR 84, irregular,
In between organ hospital, we'll have like the first line, and then we'll have like vital signs. And there are vital signs, like in real patient, usually a vital sign is like, sharp.
and then,
Like the next thing, like,
kind of getting down to the whole neuro exam, severe says, right? If you follow some transmechanics, please throw that away. That.
Yeah, all you really need is the one sentence that says neurologic.
You're right, that vital signs. You're right.
Well, if you want to get rid of your administrative, or you could just change, so if you want to get rid of your.
There's no track changes, we'll do it.
Check. The question really is, you should.
Yeah, because we can Google his.
Why don't we make it in
Should I
collapse?
change not taking anticoagulation to not taking?
He's not anything about it, he's, he's checked in for chest pain, has had nothing yet, and so he
Yeah,
hasn't.
because his blood pressure monitors are not taking out.
It would be a viable distractor,
Yeah.
but not the correct answer, right? Because you should really check pulses.
Okay.
And then you're getting rid of your administer medication options, which are
Yeah, that's
not
okay.
correct. So maybe if we just change the,
Leave them all back down.
I'm trying to figure out how to help with vital goals though.
Oh, no, I mean, that's easy, monitor, EKG,
Maybe not, maybe not.
Yeah, you could put, yeah, 'cause he's in three, he's walked into the ER, complaining of chest pain, collapsed in the waiting room, and then you can add an EKG on there as well, EKG monitor, and then I feel like it's a very bad, what do you do?
Yeah, I mean, you could put EKG, credit card, in alcohol levels, but in your drug screens,
I mean,
Right,
to-
so is that more readable?
I think
Yeah.
based on monitors,
It's pretty clear. Like, yes, and you,
Do you want to change
so you don't have a conflict.
so
You have to, you need to change,
You're in like evaluation.
you need to change the.
You can give initial triage vitals and then say evaluate.
Order of these in the outside order.
Okay, yeah.
Well, maybe for your, that's my.
Maybe even to be coming back to the not taking any medications thing, because it's a little,
It's a little long, yeah.
well, and it's a blatant patient thing. Maybe a more likely scenario would be the patient's the bill presents a settled to procedure. I don't know,
It's like 2 weeks.
maybe that's too much of it.
An industry romance is a contradiction.
Yeah, that would be, it'd be something that they were.
Like recently held.
Well, his point, I deleted mass from the CT results, and he's like, that would actually be a contraindicated.
I'm saying maybe they were planning to do like a joint injection or
In
something
my
like that.
questions.
Yeah, because like a.
Something that's not important, but it's important things,
I mean, you could honestly, you could take all of that out.
Right.
Yeah, it's one of those-
Right.
Right, although it's like a super obvious test.
I would say he's not a med, because I couldn't want to know if he's on anticoagulation.
And you're getting that, yeah,
Right.
Even with these few changes, this is a much smaller
Yeah.
question. So Sarah's sort of question point is, we could almost get rid of all of it. He's not taking any medications, he was probably just get rid of all of the past medications.
Yeah.
Because
You have to have the, all the contraindications. Because if there's a contraindication not in there, then it raises the question to the learner. If this contraindication is missing, so it should be.
So,
I think you have to say he's not on medication, right? Because I think that's the only contraindication, would be. he's
Recent
not on
history
medication.
for intracranial and spinal surgery, serious head trauma.
No.
right, so, but think about what's our test?
No, that's not.
Right, is your
Not
test
on a-
contraindications for today?
He's like-
I'm not telling you that's for a lot of students, but I should be.
Right, because those are two very different questions that you would write, depending on which of those two you would test.
But you can't give TPA, you can't give activase if there's a contraindication.
I totally understand that, but that's not the question that we're asking. Right, so if you want to ask that question, here's this guy, he
Yeah, I think
had
you said, yeah,
spinal surgery 2 weeks ago.
What if you said there's no other contraindication?
You could add that.
But
I don't know
then-
if that's necessary. So again, going way back to sort of how they suggest writing these questions, you don't need to put in, students can safely assume, yeah, the information.
But it's in my
is
view,
not
for my student, if they just realize.
Would it be appropriate to change the lead and say, no, I'm not saying that, I think more like, rather than saying the most purpose technique management, it's more like, which of the following should the clinician next consider?
You could change it to that, or that makes you feel more comfortable.
And it's not.
Because I think what you're getting at is almost like you're committing to doing the intervention without actually doing the diligence.
Yeah, and I think that, at a resident or fellow level, that's a much better testing point, right? At the student level, it's just kind of like, this is where, what's the treatment for this?
That's a good point.
Depending how to attend.
Should the MRI not be a choice?
But don't you get it?
Don't you want to say,
Yeah.
Yeah.
Could the answer be consent
Yes,
for
but-
ITPA?
Right, because I don't
I think
need
for a
to
medical
know,
school learner.
if they don't even know about
I feel like that's what you want
this
to
is
say.
embarrassing.
Right,
the student who's taking math for this question is not the student that's
And I wouldn't have read the rest of the statute.
Yeah, totally. That would be my strategy with this. is patients for
I can tell you disagree, but
Yeah, because there's, everything you do, there's action, reaction,
Yeah.
risk
I
benefit.
think
So you have to know your risk benefit before you go.
It's like in
I
addition
think that we
to.
also have to change C to all the other three are.
I think that's maybe you
And C is.
Well, that could be
Maybe
a
take
regular
out choice B.
distraction.
I mean, they put it in a.
Well, they're, we want your instructions to be similar.
Which is the wrong.
yeah, it's similar to
How about like,
No,
let
but
them
I
all,
think
I
the
mean,
key there is a good thing, like to hear consults.
because that's something that students see.
Why, like, students, they don't know what's happening. Oh, they're
surgery for endoscopy, and so gastroenterology is a good.
What should be considered as the most appropriate?
It does feel strange though. Because consult surgery, everybody's like, my next step is call surgery, why is that not a choice? Having some kind of distance questions.
Any question, this is an important test.
I like the part of like,
In one or two still do antibiotics for cancer.
the MRI gets at, like, give the intervention before you actually get the,
Right, I
like,
think that's the.
picture.
For me, yeah, design antibiotics is important enough.
Then I would change it.
To call surgery.
What if you change it to?
Yeah, you can literally state this. And not something
Off those two different.
Also,
Very
surgery, I think that's better.
Instead of MRI.
If you want to see what's
I think then I would give that as another choice and then change one of the other things.
You have time to do thrombectomy.
What's easier to work on?
That's a good point.
But they can't be the two correct answers.
Yeah.
Also, I don't think.
Yes, also, yes.
Although. Again, this is correct.
Because there might be one that's much better than the other, but they have them at least close enough there.
Because we would do thrombectomy.
Right.
Well, you would consider thrombectomy, but if it's asking what's the appropriate next step
I guess my
in
question
diagnosis
is,
of stroke,
giants.
then the next step is further imaging or treatment.
We have all treatment options, so.
Right, if you change, you have two treatments to imaging and change one to aspirin or heparin, maybe change the heparin to CPA.
I don't know, if I was answering this, I'd ask these questions every day. I don't like making one question, I agree.
But you're more likely to ask for me.
What's the difference, diagnosis or diagnosis?
But you're more likely to ask for with a stroke. If you have the diagnosis of stroke,
That one, so like.
I would think of those two things as due to just one symptom.
I was just speaking purely based on the word choice.
You're right in that, like,
Oh,
you can just, still, you can just
Sorry.
last line and figure out what.
I just think it doesn't fall in the same sentence like that immediately, like, why are we using that word?
Applies knowledge.
It started, yeah, initiates the whole.
That would be as obvious with that other just X-ray,
So
so.
one thing I just kind of consider too is if you take out the name of parents.
Yeah, I sort of agree that it starts as
Like, knowing that chest X-ray is not sufficient.
maybe just take out all the
Alpha rate.
Because that's my
So you could
other.
say chest X-ray
We're
is
more
normal.
considering the next
What
one.
is the most appropriate step, which is
IVL
for consult surgery,
Yeah.
I think we have to put one of the two, and then we could,
Do you want to change the heparin to CTA?
and then change it to PPI, like, I think those are also.
Honestly, I feel like that's a better.
Yeah, then change the MRI to
If you're gonna try and solve
Yeah.
the question instead.
Because then they're all medications.
Got a lot of good
They're
information.
all stuff.
I like that.
Students have seen the
approach
original
better.
strokes.
So the rest are,
Technically,
the rest are all,
Chest X-ray, that's
or at
not
least
me.
coagulation and all that.
Right, but some students would know, right, I don't get.
Oh, sorry, yeah, so it's like, abdominal obstruction, you want to know what it is.
To me, that's not this is part of where that.
So I think it's-
comes in, 2 years from now, you look at this question, like, holy crap, everybody's thinking data law. Right, we either need to up our teaching on that, or maybe lower this guy's blood pressure.
So what if we did an upright chest X-ray
Yeah.
with
Is it bad that they're both intravenous?
I don't think that there's a little risk involved with that, though, because.
And the other kids
We're
fussy about it.
not trying to mislead them, so I think we could say
Just take them both
that chest
out.
X-ray, considering.
You could even, at this point, since they're all medications, right, which of the following medications
I think that
might be
and
considered
then
as
just
distracted
management,
management, and then just right now, it's always the data law. They might be together, and obviously we would not.
Right.
Right. So,
I think that.
Here, come on. Medication.
You could say that you got a chest X-ray 2 days ago in the clinic.
Because oral asthma can come in case you see South Park.
That again, that's a more story than is necessary.
I would like to think I said, like, in addition to consultative surgery, it was the following. And then the answer to this is very clearly. Questions that make a testing point, at least one or two is no.
We can just do it.
that's for herpes. Right, and so now our correct answer is. And so one of the other things that we always do is like, we're able to have an answer just so that things get mixed around.
But sort of back to the point that I was making, is that you are concerned with your students know the contraindications. I would bring it to that kind of question, as opposed to trying to figure that out in certain abstract.
Which is also you're gonna think I need to do it.
And I guess, like, that kind of ties into the point I was making of, like, you have one clear concept that you're testing.
Well, because the most appropriate next step would be,
I wonder if this was
if there, that you therefore have to look for,
my suspicion is.
that's how I would, that's the right.
Right. And so I like the way that you worded this, because you got rid of that question of, well, do I have to think about contraindications or not? So that's what I'm saying, like, my problem was, we were sort of hitting two concepts at once. And so it was, like Sarah said, much cleaner.
I think that would
All right.
be the key to trying to see what they.
I can see why we
What
have
they,
3 hours to go through 20
I know, what did they, let's see, say for.
Can we make it like 6 hours?
Well, at 9 in my mind, that's always the.
Like, because now there's some stuff that's like, oh, within 6 hours, we just make it.
That's why I needed to
But like,
like
we make
that,
it
I was like,
8 hours,
they don't
then
serve,
like,
I read others.
Yeah, I agree. I think we need to write that into the
Yeah.
Because you're right.
It's
Like,
in real
this is
life,
one of those things
real
where
life
it's
is
like,
an
here's the
example.
textbook,
Yeah.
here's what's happening in practice.
If the focus is to get to antibiotics, then I would say let's change the diagnostic test to the actual value of what's going to be. The only value
Yeah,
that
I think
chest
Jesus-
X-ray in there is it makes the
Right,
performance
either is not
like a positive factor. Because in my mind, they could misinterpret chest X-ray in that sense, and sort of focus on the chest.
That's true.
But it's like we all know CT is versus.
I feel like we're.
Interesting,
It's too much.
When you go over chest X-ray, you
Yeah,
can
the
go
scene
over
that
it.
talks about moving away from a mandatory.
I think that's what we're gonna save it. I mean, because you are getting a CT test, or a CT not, but you're, like, you're still calling like.
Because that's particularly more than 6 hours. So we would just sort of like.
Well, she's 2.5 hours out of the hospital.
It took us an hour and a half to their CT. 30 minutes before it took you. That's pretty good. I think if you indicate when the curious to see what that you have the number fit, the 30 minutes to prior to your arrival.
Does it take third-year medical students?
Yes.
They want to think a bunch of those.
Should I just take out approximately 30 minutes and just, because the 30 minutes is important, but prior to arrival, of course, it's 3 weeks ago. Right?
You're saying get rid of it. I think you should. Right. Like if you're focusing on time.
But if not, if you include the time from the CT, no less.
Oh, after 7 months, I suppose.
Yeah.
There's definitely an effort.
You could say exercising at the gym
No, this is,
7 hours ago.
Earlier today.
Well, and then I
Earlier
think
today.
something we're prior to
so
it.
being in that technology, right? So it's back to being more
I think it's important to know today.
But you have 2 hours now.
Oh, yeah.
So that's not.
So we don't. I feel like the worst headache for like is the beginning. That it should just gone.
I do like the way that these questions
raise the thing.
Yeah. Yeah, sorry. Like students, stop it.
Exam should come after.
But you want to keep things good.
What I'll say for this question is like, they give it like the first 4 paragraphs say,
If you could even write,
and then
just say, she appears uncomfortable,
then
then I would leave my next sentence.
Right.
Yeah.
And then
Are allowed to use
Well, so I
examples.
think that's the way to distract
Right.
from the bio text.
Yeah.
It's not perfect or not being, right?
Yeah, well, so I think what this is, I think this is getting, I mentioned the past examples and that most preferable is like your
Yeah.
It's a resident of nuance, like how many of us are teaching our students, make it work for AAA. Some of our small percent is not going to the engineering.
Get it.
Well, can we turn here one more?
That's what I said.
what you could do is you could change option A to just.
Yeah, so this is where it's getting into, like, sometimes
As your
you
primary
have
perspective.
re-diagnosis,
E down to
re-treatment.
just,
Yeah.
get IV fluids and start.
You know, so you can maybe like, what's that step in
Resuscitation,
management?
and then you
have
have to
sort of
also part out is the
LP,
first piece to resuscitate the patient, right? And obviously call that
primary
at the same time, if you really want to go down breast tech, not
Whatever
breast,
drug you
and
wanna-
then resuscitate.
So that's the whole.
Maybe something to lower the blood pressure.
You can say like something that's more or something.
Yeah,
Yeah.
right. And so if you trim
So
them
that's-
down a
that's
little
one
bit,
area
I
that
think
we're
they're
looking
valid,
to
it takes
check.
a little of the
I guess
nuances
the
of
other question is,
respiratory or whatever, kind of add it. You can just streamline, I guess, maybe.
Or
Yeah.
quick.
Because ultimately the question is, this patient is unstable and is going to do something.
And I think D for dissection.
Please, yeah.
The number of students who don't understand the difference between these and dissection is fascinating.
But these are not,
If you do a CTA, you do a CTA without an LP.
diagnostics, another treatment.
You could add a monitor or ocular GCA or something like that for headache stuff, if you want another diagnostic.
So, back to the point that we're requesting is, you have somebody with,
I think you're saying, and that's what I'm seeing too, is that you can have more and more practice.
this is ABC question, or is this a standard question, or that's certainly recognized?
I think after 6 hours, it becomes not standard of care. You're pre-6 hours.
Or what do you think?
I would take out the pain emergent vascular surgery. I would just leave it as two large varieties that can't crystalline and across on blood.
So you want
I would
to
take
take
out
in
the same thing
another tech?
obtained to confirm before consulting surgery. Because I think, from my understanding, the learning point there is that you need to assess diagnostics. And I think many students in my
Yeah.
Feel like full IEM.
Yeah, kind of like separate them and John Howard, I'm sure.
exam, like, you have 20 girls on exam and honestly.
Probably looking at two.
I just think.
It's 59, so separated, I feel like it's.
Also shortens out your.
I think the third one is
Because they all make surgeries is roughly the same way.
But that third one's gotta go, you can't say.
But it's a separate, that's kind of stuff, right? This is.
First one is just video remain, the second one is like, you know, after the
So,
Yeah, I
that's
just
just like separate as two active,
Yeah,
that's
it's-
the best answer.
And just leave it at that. Or is that too obviously incorrect?
I think you do.
And I almost wonder if, you know, given the discussion we were having, these should be same drivers who are,
Maybe that's a good option for G. Doesn't make sense.
Yeah.
Maybe what we could
The
do
B
is
is
change.
therefore for dissection. I would change C.
We could change C to just like ultrasound after fluid resuscitation, just take the pain meds out.
But the problem is that B is fluid.
Yeah, it's a big thing.
Yeah, but it's okay.
I do look at the, are we giving fluid, blood, oral surgery?
I mean, or
Is that the main In general, you do a complete exam first, and like that's like part of.
This is a rupture triple A.
Like,
So, I guess what we're trying to ask them is,
But
what do
is-
you
I mean,
mean
is
is
that-
that
I mean, it's-
The answer is just, it's fluids and blood.
If a student saw this patient and did not check
Check
out,
out,
you could say,
Right, yeah.
do that.
And then we want
Could also completely change it and say, what would you expect to find on lumbar puncture? And then
well,
give
it's to a
choices
distractor.
of meningitis,
Goes down.
pneumonia,
That's not.
increase
But to be fair, A is also.
Yeah, no, A as well.
pressure.
We
And,
can just have that as.
Maybe the fluid consistency, clear.
I was already worried about how I treat the pain, this is not fair. Yeah, yeah.
How many of you have students doing LPs?
But also like, for, like.
What comes in, but.
They're particularly good student.
Like, total with her.
So you're laughing.
See what I think success is our last
Once I made that case, and I turned our SP from talking about vitals and all stuff, their blood, heart, and all this stuff. And I swear, people not.
So,
I didn't tell that speech
So you do this first class. What would you expect the results to show?
Honestly, if people are like, that's a law.
Oh, I like that.
Yeah. If you're thinking,
Oh, I would just say I can make water.
then honestly, like.
Right. Are we good with our four options?
I mean, you could say getting getting therapy that helps diagnosis.
I think so. I think so.
Yeah, so maybe the answer is no additional diagnostic tests.
I'm not sure.
Well, evaluate response to.
You can just take out diagnostic.
And we want just to get out of the there, it's not there, we want to take out structure large parties, but.
What if you just take out diagnostic and teach it back to?
And next test set that work up, which would, like, then you would do like,
But now you have two.
give migraine cocktail and take it out.
Two. Oh, B has two.
Yeah, I think it's good to have at least one other spot there, favorite option.
And it's no stuff in it.
Because otherwise that stands out as like, oh, that's the range. One of these is different than one of these, so it's right or it's definitely wrong.
I like that.
Because technically that is the range. It's crystalline until you move on to that side, right?
Do you guys mind if I say prepaying, but I feel good to administer ID?
Yeah.
I feel like they're gonna cross
Do
out.
you have a drug name or?
And then they're gonna be choosing between the remaining three.
Well, we're also not doing.
Maybe like working or administer ID.
For us to be rejected.
Because if we were gonna do that, we should.
What entries would you talk about? Sorry, how about
I think it's
general or
the reason as well to me is like the most part of this section, like literally.
People are in my seat.
Nothing else, so I like the things that
Yeah.
sure.
Yeah.
There you go.
What do you guys think of that?
She's 59, Amy.
Like initiate.
Also, got surgery.
Where I have a bunch of residents during the day, during the week, like that.
We want to keep the CT.
I just say this.
We have a complex protocol.
Do you?
Because that's gonna be.
Allocations also in patient vascular.
But we're not asking them.
Yeah, just like.
We're just saying, what's this next step?
Yeah, so I'll be like, oh,
Right, because it's not like a consult radiology for now.
Yeah, we can just say CT geography about it in all this minutes.
We just came in physical TT, you know, right with blood or with ID.
I think yeah.
Can you also change that
Yes.
small represent from 2 days, administer ID or infusion? Because I would read that feeling of everything.
Yeah, sure.
Another
Or
one
it's
is
smaller
small.
infusion too.
Okay.
There's a note at 4 administrators, so I can say, you want to choose, hey, if you're like, that's obviously out.
Administer. Your grandma.
Provoking factors.
Yeah.
It's 224 to 1.
Yeah, is it, wasn't it a pain or form?
So let's, before we just start, let's make sure it's a basic question.
Yeah.
We're doing a bunch of work, really. That's a great question.
We have a lot of, I mean, you could just change some of these uses, just put it there. Not stop, it's always being contracted.
Maybe first line, first
Yeah.
I think you initiate ID or whatever.
Be standard, initiate.
Yeah, you initiate.
Okay, we like the question.
Yeah. Begins.
Yeah, and it's bread and butter.
Are any of those answers?
And they might be confused because they see Pembroke being.
Yeah.
It's not, but I didn't know that they might be like, not recognized that breast cancer.
Like the family medicine resident, or future family medicine, might be like, you have overseen, you know.
Well, even, because they would come in and EMS is given benzos and stuff.
Yeah, this is, I think, going to be one of those ones where you might have to sort of emphasize in your teaching, like the way you do
I can make a big deal.
You know what I mean?
I like two that are similar that are wrong.
So, take
Yeah.
care.
Because we've been testing it.
Those drawing are too.
Well, I didn't get the order anyway, let's see if you're all that. So then the CT will be in the middle of all of that, which I think is right on, I see that it's not, it's either,
everything all the way up to on arrival.
Yeah.
minutes to
I
where
mean,
we are.
seriously, we often get that from like across the street. We're in the city, man, we're newer.
You're north?
Yeah.
I went to med school.
You went to NJ West?
I lived in North Florida.
61-year-old man lives with Alcorn.
Okay. Do you want time? So you want time seizure?
That began.
And honestly, the on arrival, I don't know how you'll describing bilateral rhythmic jerky. It's like GCs.
Well, it says he does not, it says it's improved, but not resolved.
Exam.
It's, I think. Also, better on it says persistent, no persistent recipe. There is no exertional chest press, also it says exertional chest press.
You're giving seizures.
No, I mean, that's very, yeah.
Which honestly, we
Yeah, I
can't
agree.
understand this changes to like, what is the
Even
most
just like stage 2 where it's like, there's no replacement, but also it was like.
Yeah, you put it down in front of each one of those things. so that-
Yeah, I think the duration
He has your level.
may
Particularly was not the first time I looked
point
at
them
it.
towards other areas. That's the thing, I think that is the thing that points them towards distractors. So
Yes, that's what, that's what it is.
Yeah, no, that's actually, that's really.
To me, it's like that, to me.
20 minutes long.
That is your reality. That's what it is.
Right, it's like, oh my God, it's athletics, right?
And they're like, you're intubating her, she's seizing for 20 minutes.
So then I would take out the word first line, because I think that's kind
Or
of.
rephrase the whole thing, and that's something different, because I really think you're not,
Right, so
it's
it's
like,
what's the most appropriate.
yeah, it's not what varies.
If you're gonna go ahead, so you can't be this close to a standard given. Right.
And I think higher.
Or like one round slated 20 minutes ago.
Ooh, we could have them give her benzos.
Or
And
just
the
right
answer
away,
is
James.
benzos.
But she could be fearless, right?
I think they
Not really wrong pile of
So like,
And right, somebody's teaching.
I'm looking at
That's why it's important.
I was gonna say, we start with a really long question, and we have made it more efficient, but I feel at the end of the day, what we're asking is like, what's your first line of the
Yeah.
And I feel like I need to use some type of complicating factor, because right now, that's all we're asking for.
Well, I think the company is that.
It's extensive, right?
It's just like, this is like the job.
That's why something like that, like,
This student might be like, oh, she already got.
I've never heard of it.
She's still seizing now.
I've never heard of that.
But the answer,
Never heard of keep order.
So you
but
just.
that's not necessarily wrong. You probably do both, yeah.
Yeah, I think we need to pick a different concept.
But like,
Yeah, what's the
like,
time?
any question, or like,
I like the yellow.
Well, and I think, so the other thing too, here that's kind of something I'm thinking too, is like, how great is there, like, for someone who's not, what's happening, like, it's not,
Yeah, they may
yeah.
not know what the yellow is.
but I think you
What's
just
that?
get that moment.
But I'm just saying.
Well, I guess, so the first one was.
Is it a serious?
What you do is physically ask these questions, just block the contact from the test. Because everybody's like, well, this is not how it is done, so like,
That was my rural hospital, that text stream was my rural hospital. So.
Yeah.
Oh, yeah, just these 3 questions, because that's like just how hard this is. So much
Fun, though.
considered.
There's only 6 at the table.
Question I have, transfer,
Well, I think like, what is the first question? What is what we want?
That's what I'm saying, like, in this question,
so that stuff is.
all this question's asking, like, what's your first line?
But that's okay, right? Like, I think at the 4th-year student level, like, that's an okay testing point. And that's one of the, I think, more difficult things.
Yeah, the question
You guys probably all
where
heard
to ask
because
is
not
not
being
the
students,
students,
maybe these fellows,
but I think like,
you know, trying to push stuff like, wait, what is this learner doing right now?
is, my go to say like flag this question.
Especially when you consider more and more med schools are adding.
Digit, or I think we have to.
Rotation that are always using these exams, in which, right, 3rd-year student, maybe,
How are they gonna do on these questions?
Negative component word discharge.
Third year.
But like have a higher concentration of negative components. And then say like.
Great question. First one here is
Big work here.
So, I have one main question here.
I don't have any double.
It was on the type of glycemic patients that are taking too much. What's the mechanism of action of the reversal or of the treatment to get?
You don't want to explain it. But then
I don't think that works.
The beginning of this is very long.
53-year-old female has received.
Alright, so we're moving on, we're good with this one.
We can say that it's like university to 30. These are all back up 3, just take out IDX, that's
And take out outside.
just capitalize the size.
Is it 90% in room?
And make it a separate sentence.
No, just delete IDX.
Oh.
I assume there's only 3.
I think it's relevant if there's no idea.
Yeah, I would probably take that out, but right? I mean,
Yeah, I feel like it's straight, she's got 3 nets and steroids at this point.
Will finger stick, urine, and CT scan or management, or
They, you live in Dodge, it's like, take I mean, but it says she's anxious.
These questions are very
Or, like, do they give you
Ideally, we would have to.
actually, when you decrease the respiratory rate, I don't do it. Just decrease the rate.
I just use kind of also wrong.
Yeah, that's what I just do.
It's just unfortunately my shop has to be.
Right, so.
I would just take out, I would just take out one of the diagnostics. And
So,
then you
I
have
mean, so if you're just
two meds, two diagnostics.
question here is identify someone who needs non-invasive.
vital signs?
Yeah, I mean, the whole first 5 sentences.
So it sounds like
No, you're sure.
It's an aggravated treatment gravid.
You know, the destination.
So like, has such a microaction or something, or?
I think that's like, I agree, like,
Yeah, but we need to include the.
Doesn't it? I don't
The most medical people
And
think
you should say,
trade
Sure, but.
they're not.
But literally,
Yeah, if you're going very experienced, I think.
I don't either.
you're supposed to put it in generic thing, like you're running not, and then, yeah.
Library seems like it's not great.
Right?
Yeah.
Regardless, you have just thinking that you need to still do.
Yeah, I just would put that. Okay.
That's one, yeah, that's a reasonable oral.
I think we can change that.
Yeah.
I think that's better.
yeah.
But like, does it make a difference for this patient? Like, if you have an
Why would you
undefined
not?
seizure patient, we're still gonna get a sugar.
Because I've watched the students, at least in my experience.
I feel like the question here is trying to get at, is this something here or is this something else?
But I agree, like, to me, the primary point is like seizure, sure, right?
Yeah, that gets the point, like, like this could also just be like a pre-triage patient you're waiting to fill.
like that. It's so specific, it feels a little bit like you're queuing, especially that being the correct answer versus entering information. So I think that adds a little bit of variety to those answer choices.
And do you also need the description of the seizure versus just saying she had a seizure?
I could go back and see, but I'm not sure that's relevant.
Well, I was thinking about this.
So that's why it's a very long description.
I mean, it would be about
Sitting in a chair, she's
Yeah.
like back.
it would be interesting to extract the more high-performing student.
But you would have a
Maybe just
good
add.
point.
Had a seizure while sitting in
I
the
think like that's the challenge, I think it would.
Because you're gonna have, I think the author who wrote this was maybe trying to like
I would have pause. So if you this, I'd be like, I want
beat around, you know, oh, was it a seizure, yes or no? And yeah, you're right, you know, that doesn't matter.
But the magazine was fast.
You did.
Right.
You know,
She's
it's
like,
like-
that was kind of why I had a problem with steroids too, is because I think
She developed.
we do both of those.
C is a lot longer than the other ones, but you want the.
I mean, my gosh, like you're, you know, she could be here for some,
And then
she's
she's
coming in for
down
my
my
name as
like,
as a
you know, being this like,
exam room.
learn it like, maybe first, just make it longer, or, yeah. No, it's not better.
It's kind of like longer and longer, so I feel like it's.
Yeah.
Would you say she
And
had
I
a
think
seizure?
you have a very similar choice of like going and trade motivation, I think.
No, I'm saying that part, right, you started to put in
It's good to make this one longer.
seizures, having a seizure. Yeah.
That's true.
Oh, yeah, it's slower. It's
I mean, I don't think they
can't
can
be longer, so. like-
Yeah, that's right.
Right, that's.
The only, like, doesn't matter. Hopeful versus.
I think, well, because she has another one later on, right, so I think you could just delete everything up to it lasted 2 minutes. Had a seizure lasting about 2 minutes, has been somewhere, right, so she's not going to need this. Right now, what's doing, no matter how, or just straight graduate, she just needs to run everything.
Using appropriate data. Well, so we don't need a chest x-ray.
We need all of the description to be able to know the tests of this. I mean, you assume it's a dissection in the first different paragraph you read, and then you just read all the other stuff and then say, it is a dissection.
Well, what I'm saying is, we have to get rid of the CTA, and then get rid of the murmur, and then have to give a better question.
That's a great question. Yeah, we could definitely shorten those medals.
Why does drug alcohol matter?
Yes, that is.
I was saying that too, do we have that in other
Then we
things?
need anything else is wrong, like, you have, and then you have.
She was saying, why do you want to get rid of her? You just say, we just say, keep on and keep it in for a while.
Do we have to say new? Do we just say? Murmur?
So I like kind of like.
Just visual, but-
Example.
I mean, it just tells you it's going to be today.
I think it makes the question a little bit.
When you say
I
new,
would still make the argument, you're hearing that I saw it for an emergency card. Yeah.
That's not for her, or somebody on that, just running down the hall, I can't tell.
I remember I was reviewing questions for somebody, like,
Yes.
what is the correct answer for it was a nurse who was a set.
Once you left out, these are still out, those that
Well,
want
who do you have seen this patient, because like they had a patient who was, couldn't move their legs, and they're listing the like reflexes from the physical exam.
Yeah, so this is one right where after we're testing, like, if it's, you know,
So I was like, no,
has
it's wrong.
everything,
No one's triaging students for
all
reflexes.
right, okay.
Like, that's never a thing, so this question makes no sense, and you always take the person who can't breathe first.
I think there's so many things here that sort of point to eclampsia that I imagine a lot of people would like have eclampsia and checking the urine removal.
Ortho's like really quick.
Are you okay with all?
I keep one in a drawer somewhere, so I can email that by neurologist, as well, they use that, I got them, don't do correct physical exam.
What imaging?
So what if we add-
Labs and.
I'm not sure.
Yeah, if you add this in there,
Maybe delete that, clean it up.
you have three treatments.
Yeah.
No, presence of a diastolic murmur, that's a little confusing.
Yeah, we.
Do we need to make this lorazepam IM in the?
Yeah, they don't have anything, like, we, for this order, say already.
I would get rid of that, yeah, that's a good point.
I think though it's maybe done to make the answer easier.
Yeah, I think it's get rid of the explanation, right?
Yeah.
Aspirin, heparin.
question also is, are we asking what the diagnosis is to know what to do, or are we trying to get people who have to see those grade blocks?
So that's the kind of thing I would be tempted to something about.
Or you just take off, so, okay, so you just want to take them out. That's nice.
To make that more.
There's a grade, grades down on our podcast.
Dropping.
Usually.
That's always my question for the, what's the next best next?
Yeah, we're gonna have to make choices. The ideal numbers.
If that's what they want.
Yeah.
That's not good.
But, and this is what I was saying in the talk, sometimes it makes sense to have 6 if you can't quite get all in the same realm.
I didn't teach as long as I just like I'm an administrative.
I mean, do we have another word that it's probably just
I don't know why we teach as law and natural process. We just do, you know,
Just do a regular grade blocker and a microgram one, let's stick with the easy stuff.
I think we're gonna start that some more.
It doesn't really matter what you do, just do something. We're not really that.
Have like an editorial.
same agent.
Sorry.
Yeah, it's a little different, but
So you can, well, if you want to do just one medication, you could do.
it's just not long.
I was gonna say, I wouldn't have the option to do that two things. And you could say,
Well,
yeah,
that's
we're
right.
gonna have our exam or options.
What about like enrolling? I don't know, it's because that's usually just.
Actually, roll something in there.
That's a long, I mean, we're also, we're into two executives, so we also, two executives.
Or blood thinners in a way, slash one.
Six.
And there's no change script to infusion.
Did you change the observation? In the first stroke.
Which might be, I can see confusing.
Like clearly this patient should just be.
Well, you don't have a disability.
Set of options.
Yeah.
If you want another oral, so that you don't have a single oral option, I think that might.
And I feel like
I don't
those
like
two
the
are
word
teaching similar, right?
Like, consult interventional.
Yeah. And you're also the interventional neurology, you can use CP as well.
Make it consult though.
But it's gonna be a different
Also, like,
service.
condition or like something like, like chest pain, chest pain, intensive.
Actually, that's not a bad idea, like, we're gonna do that after summer. Yeah.
Transfer for.
I don't feel like morphine is the wrong answer. It's something where
The biggest possibility of goodbye.
Well, I mean, and you guys probably do too, get transfers in, but we can't, there are people that are out of the TPA window, but they're back to all of them.
But I mean, in terms of writing questions, don't you assume you're a place that has the records?
I mean, the question very
You
much.
just have that information
to
make it clear.
And it's just saying what is the most appropriate next step for that.
We're not necessarily wrong giving morphine to this patient.
I think, because the original wording was a range, right?
You're not necessarily wrong, it's certainly not.
Same.
Based on this view of why we assigned them to supervise.
But then you have to get the context here in a place that doesn't have that source of resources.
Well, that's why I kind of like, I think a range, of like maybe that's why the person chose that.
Whether it's.
Then it could be,
You call your IR, you call the other hospital.
We need to.
It says his family, of course, that was normal until this afternoon, and then on arrival, if
But then, right, I worked on something in those meetings about parts of the emergency department for last night.
Yeah, I've been leaving that book with, like, they went out and then they came back, so it's somewhere in that.
I almost want the.
I would write it.
Like the first sentence. So it says parts of the emergency department, start with that.
It's a children, it's a third graders. I feel you said that really very long.
I know, is there, you say last week, well, then most of us would
It's
be.
important on surgery.
Had a stroke.
Yeah, let's
I was gonna say, I'm running on surgery,
Yeah.
that's one of the cardinal
Right, the emergency
complications. So
department
I
for
think
last night at
we have
weekends.
some
Yeah.
amount of
And then just stop there, and then it's less than a mile, 6 hours.
That's a challenge we've been facing with like the SAEM curriculum rewrite too, is we currently got to take out the curriculum. Is it fair to assume
Yeah.
that everything right after
After they
what works is fair game or not, if we're going to say this is applicable for 4 years?
Yeah, you're right. Yeah, weakness, not normal 6 hours.
Because one week they were.
I mean, what I was on the focus on recent we've got signs of early shock. You should immediately get some tragic shock. And so as long as they diagnose that and are treating that, I feel okay with the underlying cause.
The question is, if it's important, that's a good point, or we're putting it to the ABC question, where we pull the
Because that's like process on that.
I think I think this is too specific to.
Sorry, question.
Should we say or pass?
Yeah, he said, you know, don't primary disease and hypertension, but that's just this, you know, not getting over the life option, so my patient factors.
And you, even if you're transferring the console, regardless.
Yeah.
Depending on the answers,
Like this one?
Yes.
They're really being so bad, they're all kind of shows people.
that's all I ask.
No, and they also do snow lines, like.
I think that's something that can be recognized.
You give them,
You can't rely on that though right now. I agree with that statement, but
That's fine.
I don't think they're enough.
Yeah.
Well, there's very little education.
Inpatient
Brand new.
emergency medicine resolution.
Yeah.
You know,
If
you
you're
know,
not
every
taxed,
student,
if
every
you're not-
nurse, medical professional, no one can.
So, yeah, if there's medical, it's still built to ultrasound. So if you've never got any ultrasound background whatsoever.
They're taxed for
Then
them
you
not.
might have seen that.
Like vital signs stable, and I got one stat.
So then
It would be the alternates in part. But then just say there's no facial asymmetry.
You should, but it also, like, there's only so much you can teach in 4 weeks,
Right.
especially for students
Yeah,
who are
everyone
not
is-
emergency medicine, and then felines, I think they're going to retain probably.
Who were explaining
so
all this
I
and was
agree with you.
concerned about that.
You should.
We still do that. I don't know, we can use.
Oh, yeah.
Yeah, we should put it together.
In all fairness, law school students will only have lessons experience during the actual 4 weeks. You can teach them one thing, or you can teach them B lines, or you can teach them past tense. As a curriculum, we decided to past tense as this part of all the time. I'm not saying it's not important, it's an important topic, but like right now, the same curriculum is not there. I'm not sure.
And I also think we just don't need it for this question.
Right, do you like the question?
I think, at the end of the day, there's any.
Yeah, it's really long.
I would make the argument to follow that, I would take a look at some items, and I would also make the argument that it would be completely fair to you to break a straight question about
Yeah.
what is raising my
All right, so what, I mean, is the testing point?
Because they should be
Yeah,
learning.
I think it's a good question.
This is meningitis or
We already have
is
that
it-
listed,
What is the definition
right?
of learning
So
on?
I think the testing
On
point
our
is
side.
important. Is what
Except
we're-
you're talking
This one is just extra where it doesn't really, like, you've already got somebody on the waiting
sequencing loss of appropriate antibiotics.
I think from the STEM, it looks like we're most heavily pushing on
Because the way you make
concentration
them care
stuff.
about being some stuff, just start asking certain questions back as if they know.
Yeah, I think the order, the order, and then like we do antibiotics before you.
So that's how you start making the stuff. There's enough ultrasound based questions to verify that. I just, having the hinge point of the diagnosis, the ultrasound is probably not completely fair to all students. It's still too.
Yeah, I just,
I think it's too even, like,
Just look out for the
the question set is kind of getting like, no vocal growth deficit, which case you could, well, at least you
right now.
like, you could argue you don't need this, you could make it a 20-year-old, like, you could argue you don't need this.
What if we?
I would just like make the answers simpler, like, for an LP,
Why couldn't
Yeah,
it
that's
have
antibiotic.
a viral?
You could, but you start out after you're treating it as if it's a bacterial influence.
But I don't know if you would help you.
You would have.
So he's saying, why wouldn't you wait to get to know if it's viral first, rather than jumping to bacterial?
So option B doesn't make sense because you never.
Yeah, I think I would change this lead in. That's all.
That's something you're gonna have before.
I think option B could just be obtain a
Right,
chest
so that it's
X-ray.
clear what we're really looking
As
for.
sort of an
Here's the stuff that you said, it's like, you know, LP, antibiotics,
That's fair.
or CSF, or,
I
And
think
if you're not changing the type of antibiotics, then the antibiotics don't matter.
Right.
That's what we got, it doesn't matter, right? Unless you're changing.
but.
I guess the question is also.
I mean, I guess 'cause some of the answers are like, wait on antibiotics until you have the CSF. Also,
No, I would say, my choice was C.
yeah, right.
I think you could.
So bad.
Basics on an option that would be valid.
So A, you're changing it out, antibiotics if CSF shows.
I would be just write it like just super abbreviated and we can come back and push it out once we like it's like LP antibiotics.
Remember, that's the issue, we're gonna need to give the two options.
Maybe it's cool, you could get rid of those. No.
I think there's both I'm having a problem with like C because if you want to like large and
Do we need to add to the other answers somewhere? Do we want to have one stands out?
volume, no. And that like could be more travel, maybe.
So C is antibiotics, CT, LP.
If I pass the grade,
Yeah, that would be that, not a basic problem.
And then D is.
I'd sure like to do that.
And this one seems like.
You know, I would actually, I think it's
Supportive
changed
care.
X-ray to be,
But then that's too different.
you don't need it to initiate therapy, so.
It's just antibiotics.
I feel like they're.
yeah, I think translate like that.
I have some very passion ultrasound educators in Harvard that we recommended as.
We have three options. We have label or eight.
Bringing that in.
I mean,
The guys are doing their exam.
In 2026, it really should be. And I think that's,
Well, I mean, truthfully, that's the argument that they've been speaking with their model of
But then there's gonna be.
words, that there should be something like that, but.
I think I think that's just great. In the beginning.
The next step.
I think it's like the question.
So if you think we need to do something with C or we need to change this.
We want them to get at, like you start the antibiotics before you even give them.
Do we have the other questions earlier as well? What else?
Versus
I think
like,
A is the way to here.
wait. do the LP right away, you give the antibiotic after. If you can't do the LP right away, the answer is you give the antibiotics and then you just.
Just see if they're getting better ways.
Right, but I think like the sort of textbook point is nothing should delay antibiotics, right? You're
Right,
worried about
yes.
mastitis, that's first and foremost, right?
That's why I would just not take the blood cultures, the blood cultures.
Yeah, that's what I said, just to use those out. So now you have 3 variables, right? And then it's, basically it's 1, 2, 3, 1, 3, 2, I think 2, 1, 3, 2, 3, 1. So we're looking for a tracker, a fourth tracker.
Yeah. Did you say increase number of reservations?
My students keep another place that I'm happy, so.
You want to just go to progressive?
Yeah. We could, similar to last. I'd say where I feel like you can be better than 5 saying. Yeah, let's say.
Yeah, I don't think that answer B has like the big cost in there. I suppose you can make one of the options like administer antibiotics and antivirals.
Oh, you could do both,
Yeah, I'm just looking at the STEM trying to figure out any way to make the argument for that. There's
I
just
know,
too many
it's
buzzwords
too-
that doesn't do that.
In general, like.
Well, so do you like the concept, let's start there, like, do you like asking students that, like, is that, do we feel like that's something that needs to be tested?
Yeah, and
Because
sort of.
if you know, then.
Isn't all this is lumbar, like we just.
That's
Very
why
clear.
I'm
Let's look at answering that.
There's 2 ones that have it, this, now it has 2 with the CT having 2 without.
Is it that you're changing it about people?
I don't think we.
Well, that's what I'm saying, I think you need all 6, right? Like, if you're gonna do, which one comes first, second, third, then you probably just don't do all the combinations, otherwise. But I think the question that you're asking is, like, do we really
I don't
care
think-
about
I don't think we need to
time
question
attached,
that.
right? What do you
I think it's, you're not going to reach it.
Because we're already giving them like they don't have to tell us LP, we're telling them LP is somewhere in here.
It's more useful to differentiate this versus something else.
Yeah, like alcohol withdrawal or.
Just might
Like you,
distract.
like we're like, it's
And
two
then
ways
the
to
second
like
one
the-
is all these things.
So if somebody wants to pass,
Right.
we're trying to rule out sepsis. And the point there is to be able to then start the antibiotics as soon as possible.
It's better. I still love it.
So what if it's, how do you alcohol use, like, would be through SVP as a possibility?
That's okay to like cue to lung cancer, but it doesn't really.
I think we just agree with the start fresh.
Yeah,
Question about.
what do you want to tackle?
And this is always the time, it's like, honestly, it's just, it's not question, like, I can say what I can say, but I can say, like, you know, like, after 13 minutes, of actually sometimes it's not really. This is
Like,
not-
I know.
Maybe like a patient with this symptoms, like negative UA, negative chest X-ray.
All right, I'm just gonna make a note, we like this STEM.
Already
Test.
Like your company and.
All their next one.
Not delaying antibiotics.
Like, I think that's an important point. Because like, actually,
So when answer choice is performing the liver puncture, one is starting the antibiotics, one is, blood
Yeah, I
culture.
would like 4 BKG, but that's be too hard.
We're gonna do it all.
First,
Yeah.
yeah, it should be.
Are we okay with this? Fine.
Well, I think, I mean, OPI, I feel like is sort of the classic example of don't delay antibiotics for the test, right? Just making the words, industry right now.
Because then you're right, you get into the awareness of having this CT.
Or maybe the answer to the like, you could
I did just mention very
make something up that like, I don't know, like the CSF looks bacterial, then give me antibiotics. The CSF looks viral, no antibiotics, and then antibiotics, and then wait 15, before you.
I monster soap, but I do drink. It's my problem.
We'll come, let's skip it and come back to class. Testing is right.
Drink that thing. 56-year-old represents a son that's being very trusted.
That could have looked down.
Like, intensive, CTA, first one.
Encouraging all to
In that order.
I think this is just way out of scope. Which PEs are appropriate for discharge?
So he was at toxic to start with, but then he wasn't later, is that what the question is saying? The question is internally confusing to me.
Right. He has a group energy does not require supplemental. You did it one way.
That's a toxic call.
And I think we should be more specific about epoxy too.
Right, so I guess, so if the question is, you could just tell me he's got a CT and has a PE and this is his vital signs of ER, is he going to yes or no?
I guess of the choices.
Right.
Best.
Are you just like,
If you change the blood pressure.
Maybe could be. Yeah, maybe.
carrier as, yes, I think that would be appropriate.
Are you guys moving on anyway? Keep going. We got
So the first headache
we need to talk more now.
Probably a testing area where someone there is not.
It was all my name there. I think it was all my name there.
Hey then.
Yeah, it was all my name there.
Good progress.
Even though they live, I don't know, they were saying like, chronic lung disease, you get low oxygen, like, yeah, do not allow you.
You guys can do this.
Yeah, no, yeah, totally.
As a resident, like,
Not even residents.
your TMS,
Yes, I am. For context, my girlfriend is also in medical school, a medical student speaker. So she's obviously here, of course, so now I have to support her. And it's in Atlanta, but then when I look at the price difference between only attending for one day and attending for the next, like, okay, so I'm attending for one now, but then I start to discover, okay, this actually works. Meta, and then I look at my talk. It was another 4-hour lecture.
I don't know what happens if you don't get it. I don't know what happens if you don't pass it when you're on TV.
They're very cold, like, whatever. Yeah.
Maybe, like 30 questions every 3 months. I was like, so I did this until I get explored the test. I'm like, no, just keep doing it for perpetuity. What's
So it's like right around your daughter's birthday, so.
Yeah.
Well, let's see.
There's weird.
Yes.
Just like going to other places, but.
Plans outside of one house.
I don't know, what's your favorite?
What do you like to do?
I was debating like, say going to the good to like,
That's a thing.
like the aquarium.
Aquarium, I would do all your beer, I would do
Okay.
aquarium.
This is something.
Like, are you foodie, or are you like more of an attraction explorer?
Trash.
So, there's the Wolf Coat, I've never been there.
Oh, yeah, I got 18 years of my kids there.
The, one thing that's helpful to know, so we have the MARTA entrance, system right here. And because FIFA is coming up, they're, renovating all their turnstiles, and then shut them all down for the next week or two, so you're like, and so then, yeah, they're affordable and fair, just that. So they're probably gonna make all their revenue for the next 5 years and the next 2 weeks of FIFA's time. But, most of the turnstiles. So our train system is basically just one giant plus sign. So it's convenient if you're along with this or than that. It's convenient for me because I live in built to keep it. It's one of the important lines. So maybe I should take the train.
I think all this consider, maybe consider.
Those here,
Yeah, no, but I'm just saying, like, I don't think it's, we're not sure that I can tell us where it's going to go, but it's like,
Yeah. I appreciate it.
yeah.
There's also the Atlanta Botanical Garden. It's not
It is,
botanical garden, but it's okay.
So we go into all these order development categories, and we build water treatment plants so that we can sell them.
All right. So you guys finished already?
Yeah.
So, could we do some stuff? So, you know, then from our house,
If we need for professional knowledge,
You give her like hypertension, hyperlipidemia, diabetes. To them, it was like, yes.
or the cough. Maybe she had a recent viral syndrome. Right, but this is where sometimes adding a little bit to this down can sort of help make the other more obvious. I think if you drop it across shoulder, I guess we're not sure like get worried that now it's massive PE because we're the right answer.
Well, I mean, there's more categories of shopping, but for a lot of it's
Yeah.
Or in ways that. They do that.
However, there could be some debate about whether it's currently or obstructive, and it's technically also brain. Just like when we say heart failure, like if someone's prolonged alpha, there's like that maybe technically a heart failure.
Well, I mean, you can either do the answers in types of shop wording where it's if it was,
Did you say earlier we should avoid quotes or you said that's, there's no problem with that?
You don't, yeah, you should kind of avoid it. I honestly think you could probably read that whole.
Just the worst setting of like, I feel like it's too big. Sorry.
Yeah, what we said was you don't have to build agent efficient words, right?
Yeah, like if you write structuring,
Yeah, like that, you can say like the patient components of chest pressure.
Communicate that, yeah.
Which is the problem with
Making the
most of
student
the
translate.
Unnecessary, just tell them.
How about design? Oh.
Do we like test COPD and worse needs? Positive pressure. Yeah.
I would take care of
Yeah, let's check.
Whatever it needs to. I think once they go to cardiac arrest, I think take it out.
In B, I would take out because of the COPD, patient vascular.
Never put in that kind of like explanation in your answers because that adds a whole nother layer of.
Yes, one thing that I would think is interesting.
Well, it's right
I'll
now,
give
you
them
their
their
answer
answer.
as well.
Probably not, you know,
It's kind of like explaining a joke.
you don't get out of problem. When we were using vocabulary, 91% of our leaders think it's
I feel like D needs to be changed. Like, tons of.
You're right. I think from a student perspective, like, I think they'll get the picture that it's a severe hypoxia and all. But I think to be correct.
My things is what team was the people in the
Although you know there's many hospitals.
Is there any relevance to the gets worse as time? Simpler to reduce exasperation.
No, I think we're around to that.
What? My children are home from school and asking if they can get games on the iPad.
I think that's what my son said, I was leaving, and then like, it's all set up for me.
The first string where mom sees a picture, mom, why aren't you responding?
Pathophysiology of those compounds.
how does he?
Or 2 liters, 4 liters, 6 liters.
Yeah, why don't you say, yeah, nasal cannula.
For D.
No, in the STEM, he is something.
And you can say like decreased cellular delivery.
Could we do like 2, like diagnostics of like CTA and
So
all that?
you're saying,
And then
just ask them.
another like
I just think
diagnostic test.
this is the awful. I don't know, I mean, in the interest of me, because I do
Well, it wasn't initially like pulmonary arteries, right? Like, does this
But
guy?
I mean, I think it was.
Hypoxic attack, cardiac.
Involved.
I know that maybe like.
Decreased cellular anus return.
Right?
Does he choose?
Yeah, maybe like 10 questions. Going back to your foundational stuff.
Some sort of procedure.
Well, any of those subject exams, they
Mac
answer for
or and/or steroid.
science stuff and calculus.
Steroids out of the staff.
I'm just trying to-
Right, kind of add up the.
Having just
antibiotics plus
taken it
steroids or
because,
something like that.
I mean, those of us.
Or maybe we should just like mag is antibiotics.
They're a workout.
Yeah. Then, hard.
And then about, would not necessarily be wrong because he's got sepsis.
But like your next step is like state, like the
It's
most.
still a treatment, not a. You want
Oh,
to.
yeah.
New focus, but that's not necessarily wrong.
I think the first 3-year-old treatment science, we changed the D to be the, I like some, either decrease or
Yeah, the first three are also all respiratory treatment options, which.
Continuous albuterol.
Yeah, that's actually a good job.
Yeah.
Nebulized
you have the option of A versus.
Let's say, if the lead in is basically asking, what's the next best set? If someone's at 91%, can I just throw them on another breather while I consult respiratory or get my
Yeah,
back
could
ready?
you make them go up to 95%?
Well, I mean, I can just put in a, I mean.
So then the answer is not like more oxygen,
You know, like if we also go.
more work breathing, but
But the instructor is related to, you put in.
he's 88% and then he puts on the
Say, you know,
91% for COPD here.
Oh, yeah.
Oh, that's
Yeah.
what you want.
It's the work of breathing.
Yeah, so I kind of feel like A versus the long answer.
Correct, yeah.
Like if my resident is like,
Yeah, it's almost a coronary, yeah.
just keep your shit set.
That works.
Yeah, I like those.
But I,
Yeah.
So D
It's
is.
temporary to get the body.
So and this question is something we very commonly struggle with at MBME. I would do all of these things.
Right.
Which one is the most important one? But I would do all of them.
Yeah, so.
you could make the saturation 96.
It's actually interesting.
That makes it in classes.
Understand the content.
But that's a
You
good
guys want to
after
risk
that.
like making it
Yeah.
right from those disagrees.
The 91 makes that look better.
Then we already all got, like acute left ventricular.
Maybe some sort of, spectrometry, I don't know, something.
I like that better.
I was thinking, could you change the lead in somehow, which is the following would like provide the best support for this patient or something, most alleviate this patient's symptoms, or I don't know.
Or which of the following would,
Like these are low. Next, like,
like most quickly make the patient better?
Right.
Like, because like the steroids are super important, but like aren't gonna help you great.
diabetes got this responding to acute non-night being the right being. And the ability to move the flag, we have 10 feet yesterday, miles of 5, 10, open, 18, 1.4. Command a little first hold, better if I need, was that following step should take next. Maybe we'll work that a little bit, but yeah, I think.
I mean, if you're going to say how do you differentiate the versus septic heart rate, you need to have different. So I think you can, the temperature at a, like you might, when you sit at preschool, were you sitting, like, they get higher or lower?
My question was like, I was thinking in my mind, we were discriminating between diagnosis and correction, not the question is, yeah, it has to be doing answers regardless of the
Either way, it's happy.
Right, yeah, so yeah, no, so I agree with that.
I like the way.
So I would read more the question like that. Like instead of which of the following steps should be taken, it's like which.
I personally am interested in that first, but if you have a problem with that.
I shop, like, ultimately, you can triage, you'll get x-ray and lab triage, into the bag. So it's
What if we made it like a Venti mask? Or it's, I guess.
That's why I think quickly, it's not just refresh, which has a little bit into the part that goes down.
Yeah, that's a question.
Reality is, we're gonna have to.
Because I hear what you're saying, like, right, you know, like, that was not,
You know, perfect.
you might slap them on that.
Well, you just have to maybe.
Maybe the question should be like, which of the following tests would result in definitive diagnosis?
Yeah.
Because you can X-ray, you can do either MRI, whatever, but
The question I'm not getting is like all of these contingencies, like if all of these are immediately available, what would you do?
Because that's why the explanation was,
Right.
you're out of pocket with an x-ray, or they will get an x-ray. To make it the shortest question. X-ray.
Everywhere else it's written out.
Yeah, you should have probably helped me now, so I'll start doing that.
Like, we have MSK leads with a case
not being self-help, I'm just 3 hours, like.
Well, she was in some kind of like ER that they just took, so there's like the attacker just.
But 55-year-old chest pain becomes one of those theory less considered.
Other than me, who's vacation works at the VA.
No, I mean,
Like,
it's
your
tech cathartic.
oh, that's a thing?
It's tech cathartic. I mean, you could change it to like Annie or something like that. But he's tacky, like, you don't know if he's.
I asked a resident to give IBD the other day, and they looked at me like that too.
I texted my residents in the group, and I was already on the VA, and we had a patient in our bed.
Oh, okay. According to
No hospital.
Well, when we were at Guyana,
Just how many
Oh, just a black and white image of the top. Okay.
Students have purpose, I guess.
According to the internet, a highly accurate source.
Wasn't digital.
So we're gonna make one for.
got a lot of history there.
We're gonna.
Yeah.
Yeah. They don't even accept to try and get back to do that, where I work through school with the thing, and then she goes back at the time.
Trying to go down to the department of this area and being the parent and the testicles, you have to go back and look at this society.
They're different. But it's a different version. I guess does the chest X-ray add much if you're saying there's freckles and all that?
You take out.
Take out
Then they
the
have to
dye
interpret
or the chest
You could
X-ray.
just ask the X-ray to the other question.
And this, I mean, this guy has paid by here.
But this one has more, or like there's structures and elements you can look at things.
I mean, because I honestly got to figure I don't do even like actual field. I tell them to figure out it takes 26 hours to get to a room. And like, do you want to go see your primary care doctor, have it done, or?
I mean, she's tachycardic.
I was gonna say, it's so like, not just making diagnosis, but knowing specific
A BP of 218 and 1
I think it does come up as.
So that's what I'm saying, like, I think that's where this question gets at, is that you're considering all the differentials when you hear that history.
Doesn't that make that feel like a very good question? Regardless, it's got too many. I don't know. You're thinking about this.
I think it's a really, like, realistic,
Yeah, I saw all the distractors really.
interesting,
well as
right?
possible, right? But I kind of.
And you have to go step by step and say,
I don't,
this
I
is
think
the,
that, I think this approach is very nuanced.
like this, is this, COPD,
Well, like I said, I see a lot of these guys, I think it's probably they go to primary care to follow up, and that's when
I
they
think, I
decide.
kind of agree with that.
Yeah.
Lost the chest X-ray.
Well, I think the better question is would be, this would be a reasonable question, can we change this or what is this the second visit for someone? I mean, that's what it's about, question, but you're not asking about this to do that.
Right, that's right.
Previously, they were trying to talk about 2 weeks ago.
Things and that.
This was like, when these things just like, I would have done that, well, not these are my very often. So that I
think it's not.
This is amazing.
yeah. 2 years ago.
Yeah, but
Because you're talking about diabetes, because that's different from funding as you're working features, you just not on the first time, because you work as a patient.
Yeah, I think I might just read it as a hospital patient.
Or
triage patient who's like, put in some labs and an X-ray, and you're walking up to the bed, and they've already shot the X-ray, and you kind of remove that.
Bleach.
But after COVID, when the physical exam passed that.
But like, you know what I'm saying, if you walked up as the portable X-ray people were, you know, putting the thing away, and you could see that film, and you saw that triage notice, and you were going to the bedside, like, I can't possibly order an X-ray. They're listed as well.
Is having both antibiotics,
Because really the question is, do you know how to treat meningitis? So something you cross out.
No, because it's a distractor.
So you might like, I guess you look at that X-ray and be like, that looks like pneumonia. Like, and so then, but then you might cross it out because of you're like, oh, I don't want to get this patient on all the, you just do antibiotics.
It doesn't look like low part.
I mean, like, it doesn't look like pneumonia, but could a student be like, yeah,
I
it
feel
looks like
like-
there's white stuff that looks like.
Neanderthal probably is the
It's the only non.
It's the only non, you know, like, yeah, you're right, exactly.
Yeah, I feel like if you're going to get better.
That's what I like. It's like clear, but I think, but I think it's.
You like look at fluids and be like,
Yeah, I
no.
think you could argue that. Yeah, you could argue that.
There's like 4 or 5 pieces of information that that's very obvious. Like,
No, so ivermectin needs to come off, because it's just something.
I think both ivermectin and Amorpho, like.
I feel like I see what they're getting with this, if you only draw the antivirals, you have a very significant medical history that would say you standard this is just over age 50 when you're supposed to do. So I feel like the appropriate negative is like is a second year from the correct answer.
Yeah.
So what should
Not
you,
reduce the risk.
what should you,
Not
what should you do to someone else?
What if, sorry, going back to that. What if it was like, you know, the patient's breathing really shallowly?
And then I would
Weird. That's
ditch ivermectin.
sorry, never cancel that.
Seems okay.
Encourage students in that.
Well, but I think that's okay.
It's a good question, like,
I feel like that
is
was-
the antibiotics for?
That's the trick.
I feel like it is, but I feel like that's a good.
Yes,
And it's a not reduced, so it's like not reduced, increase the risk.
I guess they're going for.
Increase the risk.
Right, but that means that 3 answers are correct.
For patient with fracture for listeria, consider adding yourself.
Would increase. Okay.
Just like that's just nice for the like, happening before the
I think
patient.
it's pretty clear.
A lot.
Yeah, let's start with the answers.
Yeah.
Risk factors for
Is
listeria.
it what you can do to prevent
Very
intubation?
pregnant, blah, 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 consider adding ampicillin.
I think,
Just change
Okay,
the
well-
question to that.
Well, in the non-
Their statements that says.
Yes, there's-
You just have to change the verb, right? Just
Intubation, hypotension is a thing.
just what you said.
Yeah, it's like.
We're pretty
Jill,
correct.
discussion.
Or can you change it to a question about like the.
Yeah, they already got it. Yeah, now they got it. That was already.
Just get rid of not, put the right.
Yeah.
Well, we'd have to rewrite all of the answers.
The only one that isn't, so they also talk about potentially doing
Plausible strategies that might reduce the dose.
Well, it's not steroids should be steroids, and that would be the right answer. I would choose steroid working if you give me this question. Yes. With steroids, antibiotics, like most of them. Like, you know, he said 80. I would equal.
Nine other questions, well,
Will not reduce steroids.
will not reduce the risk.
Well, so what if, I really like kind of what you're saying, like, if you change it a little bit, we give some vital signs and stuff, and then it's like, which of the following should be done to prevent?
I just like it being enough in the last few years.
Yeah.
Because they've heard of it.
You know, like, how do you optimize this patient prior to intubation is really a question that we're asking, right?
For practice, it's a hard question.
That's what I'm saying.
Well, Doesn't
stuff
mean
where
there's not
multiple choice,
choice.
yeah, like it's for multiple choice questions, because like you were saying, coming up with options that are reasonable but wrong.
Yeah.
Is really
You don't really think
tough.
that's well, when you know.
And I almost like want to ask the question, is this really a area innovation and potential question, or is this more about like how to use your brain with the question? Because like fundamentally, like what is the principle? And not the first. The lead-in would suggest it's area innovation strategies, but the fact that they would need to make the distinction, no, you're not going to have to hear that.
What is the most appropriate next step?
Well, and in fact, actually, as I think about it, this is really, like, you don't even need the step, right? You just, which of the following, like, that's just a knowledge.
It's not in
question,
fact.
right?
Is something we have for medical students is to be.
So,
I'm literally looking right now.
I mean, I think they do still need to know, you gotta give us lots of blood back as soon as possible. But the question of like, you don't have these are all. You can take that out and still make the.
I like when you're adding stuff to the chat.
So we'll say we have this as an example.
I kind of.
They will often answer me towards it.
Do you have questions to get?
We used to take out the
I think it's
part
to
still.
go for a multiple choice question, I think like it's.
Yeah, I don't think we can
Literal
resuscitate
quote
this
from
version of
the
this.
section.
Do we agree that this is sort of
It's a good concept, yes.
For a fourth year?
Yeah, I think it's hard for everybody.
well, I mean, we talk about innovation, I know we don't management, right? Like, that is definitely make it harder. And so it's sort of feel like, like, we actually have a good buddy on, optimized applications prior to
Oh, but
innovation.
maybe it's expensive. Because our students.
That said, though, I wouldn't be shocked if the student.
You know, highlighting has to go with that.
They just got caught up in it.
Yeah.
Yeah.
I got stuck on bad buddy.
You know, like, the things that you.
Yeah, that's what they're called.
That's what they're doing. I'll add that to the, okay. Character goes bad buddy. Yeah, what about ours? Long time ago.
We need to have that.
Is it in the curriculum?
I have trouble finding it, like
The airway is.
They're trying to say it's like kidney stone. If we're gonna take out.
It was like, there's stuff in the curriculum about like the principles of intubating and asthmatic.
Here, this is, there should be consideration optimization of hemodynamics. There's a prayer, like, the blah, 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 consider IV
So we,
infusion,
if we're gonna say
blah, blah, or IV,
This is actually.
acidosis.
How-
You're just going,
I know.
I was trying to find the.
Just say, for examination or deal just swollen or a hard high riding testicle, you just have to look hard there.
I know that's important.
All right, so, like, the concept, let's just not question.
Basic aspect of providing initiation.
It's already 4 o'clock, we're not.
I don't know how.
All right, 13.
We do, yeah. The hardest problem that I have is getting them to order and rerush because they aren't going to do the state reporting and they
That's literally the only thing, testicle diagnoses that I care about, right? And I would say laboratory studies, but that's where it's.
Honestly, I'm kind of okay with options.
Yeah. Maybe.
It's actually objectively lower.
Prioritizing airway management.
Take out.
If you want to talk about how you need.
Please don't.
We're just worried about it.
All right, I like this step. Take out some tech, but I think I like it overall.
Yeah, maybe take up that comment.
Yeah, they have that there. Each person answers so as long as they're all.
Yeah, I probably would just take that out.
I think I got it because I think
But it's fine, just names or choices.
why you elevate the high riding.
What
do you say lower? Like, yeah, we're driving. So go ahead. 24 don't need no history of most of the various development.
Like, honestly, that you could just get rid of
Here, right?
all your numbers, right?
Because the trauma team is assembly.
Like, here's this patient step, and one or another, right? And then it has all of these hard centers, which is the bottom is the next step. And, you know, that's it. The question.
Patient appears on approval at right beginning. Yeah, the examination is looking to choose where right.
Answer A is probing you to.
Other examinations. But there is, there.
You have that because it's.
Because.
Following because of the basic commission. Age was
So do you just say after CTA?
But then I wonder if you just say promote.
You may have to share one with this provider.
Yeah.
And have the commission
I feel like suggested though, or, you know, and saying about.
Yeah, I kind of feel like C should just be like
Maybe we don't like that.
resuscitation of airway management.
Just prioritize airway
Right?
management.
But like, she
Because you're not doing the station of blood.
Or, you know.
Well, so, but airway.
No, I know what it means, but I've never
Intubation
used
is
it
what
in
I
like
was, you know.
that kind of a, and probably give it blood, you know, it's like. I would. Simultaneously, you give the blood while we're getting the stuff out.
That's gonna make the correct answer really long.
Yeah.
I think just for,
Initially
like,
trained.
if you put an ectopic records in and a pregnancy test, I feel like that's. You know, like, well, can you have it?
And then what do we change P to?
No. I've never seen that.
Go directly.
But,
82 was my lowest.
yeah, I thought.
Cross-rate ectopic.
Yeah.
My most recent.
That would actually probably be very good with the
Commercial company test is fine. In New York.
50, so like,
Arrange for transport to the operating.
But,
they're not, it's always some weeds.
yeah.
Well, yeah,
And then, but like, when some, in this case, except for the initial plan, that could be a stone. Yeah.
Well, one of my things is
Well, Sarah's point was you probably should
change it to
stabilize this
You
guy.
can also have
I'm like, it's getting more,
Yes.
I should say comes and goes, or just say regular,
Everybody's gonna be
intermittent,
different.
regular, conversation, I'm fine with any of those.
The PCOS
Yeah, I think maybe, but I think it's like,
selling this.
we don't send them up to the
But I think
OR
we dropped that
with
right
that.
away. We made it
It's
like,
like,
tell you, it's a variances, which is funny, because I don't even associate PCOS specifically with this. It's not cold.
Neck bleeding out.
and,
Pressures below 90 at our hospital now.
maybe like,
It is, because they don't all form cysts.
yeah, because it's a specific,
Yeah,
and
so
then
we're not typically diagnosed a lot.
we're just riffing.
Like, we have, like, we have, like,
Yeah.
normal problems that they're.
Like,
I mean, I kind of agree with you guys, sitting up and leaning forward and doing what's happening. I don't know that I'm like,
The cysts.
airway is not first.
Always
there.
there.
But it isn't actually like
2 days yesterday.
Yeah.
2 days ago. So my most recent torture.
So should we change C
Fiber
to,
optic kind of a guy.
Yeah, sign out to me.
would you say,
use available
It's
resources.
in my head, but.
Yeah.
Well, it does, but it doesn't really, because like, what's the bad compliment? Well, what's the bad compliment? I mean, yes, they went to the rotary out, but like, she was already like in front of her.
So you think the initial tenderness?
Well,
Advanced
yeah, the
airway.
other question
Say
is,
that it's more likely that
it's, where I did residency, we actually had like a weird protocol. Like, this is a guy that they might use a agency, but
they might switch to the OR.
taking
I know.
This portion is so common.
Florida wounded defense. No.
Right, you know, like.
Yeah,
And none of us are making it. It's like, all of us are thinking that, but it's like, how many of us have done this, had this presentation?
Well, what if you
They have paid for it or something.
Her UA shows That's
Then
what
you have
I
it.
was. Because you can have a snow.
Yeah,
that's what, like,
It's not unreasonable, but it's just not come to that point. But I think we are getting to the statistics.
You know, our side,
I agree. I think
Well, and to be fair, if we don't set frequency in the step, then you could say, oh,
Yeah,
there's a
it's
handful
just-
from
it's
rate
just-
pressure, or here's from gravity haters. Like that.
Okay, so maybe.
The students come up with these arguments, right? Like they,
Sure, no, you're, I mean, you're right.
all of these things.
And stabilizer. Maybe blood transfusion as well.
Well, we
Stabilizer.
put the blood transfusion.
Urine testing shows no blood.
Well, his pressure's 84, so he's gonna need blood. It just makes C secure airway.
But what, I guess, what does that mean? Right, like, 'cause that's gonna be what things, I don't know, my body right was.
Mine already died.
I like the idea of putting RSI in there, because I think in this case,
Yeah, the problem
RSI
is
is
when you put that there, then you lose C automatically. Yeah.
Like it's so.
That's
Well,
hard.
Yeah, I know, and we can take out the WBC.
I like that he's very unstable.
Right.
Well, you could,
But you could take your.
you could switch the urine. Switch.
So, yeah, but what if we took, like, Monica was saying, you know, take out the horse, what's that voice, like, you know, he is able to.
Yeah, but heterotopic
I
pregnancy.
can feel like.
Not heterotopic.
You just want them to do ectopic or?
I think it'd be Craig.
I mean, that's not the presentation of ectopic.
No, in this
It's
person.
still
Yeah, but it's not starting with WTI either.
Yeah, places where anesthesia comes to constant airway.
The problem is you just gave them a test that confirms that.
Yeah, I don't think.
You shouldn't make the ER without a airway.
Regardless of who
Left,
does it,
really.
it's still within the grasp of the student in the SRE.
Yeah, I think we should need to think.
Wow.
It's kind of.
I mean, you could also change it into what's the next diagnostic step, and then your approval, CTA, operative,
Yeah, but.
exploration, and one more thing.
Like a human system is third. Does that mean
The next appropriate step is security.
Viral infection.
What if we just give them the pregnancy test and it's just not?
Again, you could say, after securing the airway, what is the next
How are we taking
most
this?
appropriate diagnostic step?
Oh.
Right. But you can give them probe it, give it CTA.
But it'd be largely.
Should we go a different direction and make this like, maybe a little, like, turbocharditis or something? I don't know if it would be the right choice, but that would be a right requirement.
Well, I think they, like,
I was thinking.
one
like
can
viral
recognize
infection,
that, like,
but
this
then
is
the whole and
expanding hematoma, like, this is an unstable airway.
inflammation.
And you do that before diagnostics, you do that before,
Infection of.
I guess I could see a scenario where, like,
Yeah,
it's okay, but he goes straight to, he gets intubated right away in the operating room.
Yeah.
So, the D, I think,
I like that.
maybe that's not like,
Looks bad if we crash.
right, like,
All right, so what if,
C is more right than D.
what if we had a thing, like, 2 large bore IVs are placed, those products are initiated, his blood pressure comes up, and then E instead becomes like observed or something like that, or I guess that's something out to a CTA.
It's observed in the air.
The PID one.
I guess I was trying to say,
I think it's in
like,
there.
taking out the difference between airway management and transport to the OR, because I think some people are going to interpret that as go to the OR for airway management.
Is that allowed to push you when you give rise to
Maybe you could be more explicit and say, transfer to the operating room.
But if you're
or-
looking at your testing strategy, it's pointing you in the very correct.
You do.
I agree, I just am not sure that we can say that.
Yeah, because, so A would be,
Underlying etiology is so
exploration at bedside. D would be exploration without.
Like I can argue with someone who told me that, like, I like them, but I think like, what is the most likely? Like, I don't think you can confidently say.
Because you don't want it to go to the whole.
Statistically across the entire population that was
That would be a long answer.
So what if we change it from immediate transfer? I think that's where I'm struggling, as I sort of, analyze it like, you know, a range for operative expiration or something.
Yeah,
So it sounds a little less immediate, and a little more like.
But that's still right.
It is.
No, where is it?
The next
arranging is
like, essentially implying that,
Oh,
like,
I see what you're
right.
saying, yeah.
I recognize some students.
The immediate thing to do is to create your.
How do we push it a little bit?
Push it further, push it.
No
further.
point me or anybody.
Yeah, I guess where I'm struggling is where I'm here, let's see this.
Well, then, okay, so then that makes sense that you're right there, you know, is it?
How close is your award to the
Very close. And if it was sitting
But I
out
think we
in the
should
dry
try
house,
to
things, these out, just like, fuck this, we want to do it all our stuff.
Well, because you're close.
Because then you're taking that, then you're taking some.
Yeah, but that's, we gotta only break as a national test, and so.
Then you're
give students
splitting it.
and some.
Because it wasn't even a different thing, it's like comparison.
could we do like consult trauma surgery? Like, or I don't know, if like you could just imply that there's like, and they would be there, but like,
The only other actual real competitor in this is.
I like
cause like you know this is happening, but like,
I like the answer.
So if that's the case, I say put the year results in and just let me hang out on it.
For fourth year medals.
Yeah, I think you said it right.
Good, we want Mark to come back to it. It is.
This is, actually, you know what,
About it more.
I think we could see, just do this one as is and see how it tests. And
So I guess I think-
discrimination is
I
down,
guess I
right?
would do that.
Yeah.
Or like, you know, half the people are picking C and half the people are picking D, then we're like, okay,
You're a good survey.
I think we know what else will be.
Is that, it's a good question, it's a good concept.
Yeah, I don't think so. That's right. I know. We're also concerned. We can see actually the two going, two, we can go.
Where's the staff? The truth, as far as tests, the writing, you want to establish the last gap will be in the first sentence.
Or just to the back or to the upper.
Yeah, I kind of agree, I agree, that one.
So,
To the back. Yeah, but it's not like that.
Part of the initial evaluation.
it's not like, it's not like,
A, head, B, MRI, brain, easily.
Yeah, because the patient would just come in and be like, I got stabbed, right?
Yeah,
You have to look to find out. Yeah.
Here's the steps.
Yeah, either give it to them or make them figure it out.
Say after it.
After being stabbed.
I think you could short basically just say that gradually he is improving his condition.
So,
Especially.
either pneumothorax, just in we're either asking what's the physiology behind it, or what's the right thing to do.
Does that mean before he?
Say that again?
The new lead-in is asking what's the physiology behind.
Oh, that's the second one.
Describe laying on the ground or something.
Yeah, see, this is like a 2-for-1, so I do this all the time when I'm writing questions. Of, you know, oh, I have this great stem, let me make 3 or 4 questions out of it, so. Right, so do you like the first version, let's start there.
Yeah.
Making a clinical scenario and then using
We can use
that
both.
STEM to make different questions, have one version in my lecture, and then have.
Yeah, what the MDME does, they actually, you know, so they have this whole massive database, and they label questions as they call it meta-leads. And so it's like those 2 questions. But you can always version on one test.
But maybe it's retaining that.
Just take out
I never have the same question in the different contexts, but they're related to the same.
Well, and I was tempted to get like, just to
take out.
So it sounds like 14 kind of.
Whatsoever, but then if the question is asking, what's your workup for next month at Seizure? I think we're also really not, we're
I will
asking,
note,
you guys felt,
happy,
like, and just kind of including them into our getting the CT, making it easier than that. With it's a head trauma, I think.
Oh, for a little bit more sure, that's right.
I'm just gonna.
yeah, probably more happens, probably.
Right, exactly.
Physical exam saying that there is no evidence of trauma? I know, right?
Or bystanders. Bystanders report.
One question there, Ron.
It might look like the end without contrast, because some people might not take MRI and not because they didn't take MRI, but they really know the seizure MRI.
Well, it looks like a new version. It's just around.
Yeah, the new we did.
Yeah. I feel like we just have one on the other questions. No?
I was trying to think.
Well, the physiology, it might have been
Over the
another
years, I've
physiology
written all
question.
of these questions.
I know.
They wanted to do this.
So many ways.
I remember one having to think through physiology, but it might have just been another physiology question. And
Well, it's like sepsis, tamponade.
I think that is all of us, but we should do both.
Logjam or.
But you're in Clerkship. So you're not all.
Our girl is on the
Well, and like, in real life, yes, I would probably end up doing a tox workup, but we have to assume he's not lying when he says he has no seizures.
You want to put E,
I think.
an answer for E? Right after the answer for E?
My gut says leave it off, because if he's saying that there's no substance use, we're gonna have to trust him.
Just as we.
Oh.
Well, I guess we said, but if he said his doctor's lab test were already done, so I guess.
Can we just survey the finger stick that goes with, because he was transferred by the ambulance, right? Can we just say that they're on the finger stick with them and that will last on?
We can take out the labs that are.
Right? Yeah. I think the miles, I don't like.
Yeah, it's like a violation.
Or you need your one with the labs in the one.
I just really want to answer, so.
None of these are.
It would be greater part of that vote question.
Yeah, if they got there on their own, it's not gonna
This is
trigger.
like, this is like my emergency medicine. 40. About medical school, like, stop, tell that, and it has to be the worst thing. No, tracheal deviation is not the key symptom for pneumothorax. If you miss a half hour, your chest pain there, hypoxia, and hypertension.
I was like to say, like, everyone who's had a headache has had at least one worse headache. And they're like,
Well, I've had two people that had a complex headache.
Do we ever talk about heights all the time?
I've had two people.
But I think you they do that quickly, and then they be like, is that time? Is that?
Yeah, I feel like that's
Yeah.
sneaky.
Which.
They're not supposed to.
I was like, really? Okay.
I really feel like the
Once you say, once you ask anybody in the emergency department.
Yes.
I'm here, that's why I'm in emergency
So they
department.
have one of the
Right?
one therapies or whatever, right? Like,
Which are the following is the most.
oh yeah, that's probably true, which are allowed.
Right? Because the real answer is also a
I think that makes you good, as far as a good distractor.
I was just gonna, I was like, that would be you.
I don't think they specify we need to get any labs because it really isn't necessarily, but really
just want to make you feel better.
Did we say we're okay with the second half of the time?
Give up and just leave it.
I just want to make sure the reason, like, it's not a trap or something just skips it.
Yeah, that'd be fine.
Yeah, that'd be fine.
So that, right, it's kind of like the change.
So the concentration.
Yeah, like that question you guys asked me well earlier, the afternoon before they done that.
But that's a fluid because at least heard it, right? Like I've never heard somebody like, I need a liter of hypotonic saline stat, like.
Not my best, CT the head shows no CT and ARP demonstrates proximal right is required. Timing of the system.
Because this way they have to think about like hypertonic saline. Yeah. Oh, no, that's not happening.
A, B, C, national conservation. D, emerging radiology. I like that.
We're all in training.
Yeah, I like
We're all
that.
in training.
No, that's not where I go.
Yeah, obvious, and like obvious, abnormal, obvious.
Console, diaphragm, and walk away. I mean, if you're gonna give that word studies at the end, I think we're gonna cut out our luckily just contracts.
Yeah. But also, yes, no.
Yeah.
Well, he's there. No
Well, that's include
Would argue that
test question.
might not. That's what I'm struggling with. This is.
Well, again, I don't think about that because you already give all these thyroid studies, so.
No, we're not. They
None
got
of this stuff really matters.
They're trying to run.
Yeah.
Say CT and
Although I feel like it's,
We're just getting too into the weeds for.
you know, also don't think like
I
it's.
think when we start talking CTG.
I mean, what if you just take out the thyroid
No, I don't
diagnosis?
think they need to.
Take out all the thyroid study things and which lab tests are.
Can you just tell them that neuroimaging has confirmed that he has a mental disorder?
Just recognizing thyroid disorder.
With the.
Which seems more of a mental, yeah,
Just the 6
So
hours.
this probably to push to the lows.
Yeah.
They go to certain institutions, but I'm thinking maybe we stretch this
You
out
could include-
just a little bit longer to make it more
like
clear.
an alcohol level, like thinking about withdrawal, and include
But I feel like
blood culture,
even setting up like
chest
when we have
X-ray,
like,
sepsis.
ultra fast, like we're seeing extended TPA.
And that's what I always tell them.
Yeah, I've had a neurologist sometimes think
Thinking about
about
it and stuff.
Yeah.
We
It's a weird,
like.
it's a
Like,
weird.
once you have the app, but yes, actually, like, I know
Yeah,
exactly.
once you
what
get pulled back, like when you're doing this in the last.
I've been to.
I would take everything just in 3T3 out, and I would take the thyroid.
No.
And so then we would just have a.
We had a
I mean, that's
vacancy
awful.
for
That would be
history. You would just let TTA get everything answers. We know the right answer that we're going for is.
Well, I had other patients that seemed to have
So plausible.
intense and would have answer for a case straight up.
Well, I agree, like, he's got a tremor,
And
right, so
actually,
alcohol,
that person, the
withdrawal.
only reason we didn't take that person is because.
But you have a like,
Didn't know it was So, like, if they were like, yeah, the neurologist said I had to get this, and we're all the time.
I think so. I think that's what she said. I think
Something like,
the 6 can be a little vague.
thinking aloud here, but like, what lab abnormalities would you
I don't have any
expect?
problems with the.
In this
nutrition,
patient's- And then,
I don't have that stuff.
but like then something with like,
We can
So sometimes we've written questions like that before, where it's like a chart. It's like TSH, T4, T3, and then you're like normal, elevated, low,
Yeah.
right? And you put different combinations of that. You're right up that.
Which pattern represents this patient's most likely diagnosis?
Yeah. Right, so, you know, like one of them would be like TSH normal, T4 normal, T3 normal. Probably not the same. TSH high.
Where you have all your answer choices be thyroid,
Or
determining
venous.
the differentiation of this between sepsis and record.
That's a good question. I mean, you could do both of those questions, right?
Two thyroid, one sepsis, or
No.
two thyroid, one sepsis, and one hyperglycemia.
Whatever the.
Well, so let's come up with a differential for this category, right? So we said.
Routine, I think everyone has not given through for CTE. Some centers get a very small.
The apathy is really good for thyroid, I like that.
I think it's still a top choice.
The fever.
I think if we're at the breath, we're going to come back to me.
Yes, sorry.
All right.
I like that actually. Give them like a med or two. And then
Sure.
what you got?
We need burps, but like, I really like, I'll get aspirin.
Another
Almost
topic.
that you could put it as them, all the treatment should be downstairs. Right. Yeah, and that would obviously the need for. Maybe that is to guard it. I think that is right.
That was really the
Methamphetamine. LSD.
I never am. Yes. We have a couple of regulars. Doesn't look fun. But PCP, like PCP is just much fun. It's never gone away, as far as I know.
Use some sort of
I feel like you want sepsis, right?
I was in nursing
So there's a couple problems with this question that I'm seeing every day. I would say, like, I don't know this question. I don't feel like it's asking you anything that's.
So I guess the problem is having.
The question here is D, like, that's it, like.
It's this long history.
But it,
It could be two things.
right, yeah, that's why you can't telegraph so much with a formal, that's high in the question, there's high suspicion for infection. You can't just perform.
Hazard going on for so long, so it took away that 2 months.
Well, then you almost have to ask the questions like, what should that
You
be?
definitely just
That's what we're asking
Yeah.
here.
Then you probably need to ask the
following
question.
is the most likely.
No, I don't think you need to say, given the high suspicion versus some serious mental purposes.
Give those 4 choices.
Just what is the most appropriate news now? Right. Most appropriate, I mean, you know, it's.
And you take out the seconds.
Let's see. The checkup on virus.
Yeah.
And I bet some people would think sepsis. And then,
Even with the 2 months worth of stuff. So
I think it's a lot, I
If you
think,
take
like,
out the
kind of,
portion of it or utility return.
He's got prostate cancer now, 0.7.
You know, whether or not they're going to end up before they do antibiotics.
Okay, your time.
Yes. Well, probably not.
He's one set, at least in one set.
Yeah, you can get one set, but get the antibiotics started.
As long as it's not in the overhead.
Well, no, because he has deficits, right? He's confused, so they're like, he has deficits. Don't worry about that.
I think we still should still choose the advisors first.
He should, yeah.
But I would be worried the first thing he's.
And in the real world, when I discuss it,
It's good management.
Because he's gonna run just for learning. Yeah.
he's gonna come in through triage, he's gonna get ordered, right, go there.
Should we just change down maybe this? I mean, I guess this gives it a little bit, but it's just enough to do it.
I think because then you go to this like, oh, he's been having recent.
Because you're gonna actually-
Yeah,
Right.
like, so
Yeah.
we're-
I was just gonna say that, you really are.
Obtain infectious disease control.
CDC.
So is there enough information to differentiate that?
James and Bleak Lake now. I like that, infectious disease consult. It's a loose law.
Proptosis.
We need to infectious disease consult, CDC. Consult. Yeah.
Ooh, what if I actually
Because that's a lot.
I just had a CT scan every time you get on fast for John Muir.
But we did.
No, that's not.
There's a lot of different.
No, I heard that.
So we're really strict about it. It's really.
I feel a lot more of this is okay.
Yeah, that's what they say, I mean, they.
I guess the lost weight is
They
supposed to
think
be,
about it for a long time.
that would fit more with.
It's usually when there's a consequence that comes.
Or like a cancer.
You're right.
Yeah.
We can get adoption on this one.
Even if that's to take a CDC.
Or this is your trend.
No, I still, yeah, here's the, in shot on the top of it. But all it, yeah. I just like kept going, like I invested in there. And
Burned out. I'll get her.
no, she asked me how, the lady when we were done, she asked me how high it was. And I was like, I don't know, higher than 55 though.
You just collect the stuff from there.
Yeah.
So if.
Well, I was so distracted with it going off the top, I messed up the little stop cop thing and I didn't catch it.
This is not.
I said, it just keeps spewing out.
Everything is official, where like it's like, so it's not.
What's the psych med?
Or it just starts coming out.
Yeah, that's what I was.
Yeah.
Working with somebody that we
We did have some
Well, you're opening up with Mr. Betty's for house fire.
Google says that, but and that's probably about it.
Times the rescue event, after the time being slow go.
Taking a long time.
Taking the over ID, all signs of temperature 99.0, pulse 35.
They all disappear.
Aspirations to 30, pulse off about 90%. On examination, there are no burns noted, but the skin appears to be. The lungs are cleared, also smell out. The nurse brought them to the right letter. Ways of all it was probably there all the time. Answer B, C, I don't know all about this. Maybe ever spoke.
Yeah, all that is on history.
Yeah, I was gonna say that.
Yeah, not forgetting
It's very correct.
I like the methylene blue that comes in the mouth.
Oh, you're right. on. Right, but now it starts nurturing bad, right, and then sort of hints at the depression that he's been losing weight and all this stuff. Which makes it a little less out of this thyroid. There's nothing about alcohol there. Yeah, I think alcohol was all about kind of like difficult one.
Is it 92% correct?
White fever without hope.
You can get a low-grade fever with that.
I say it's like mine. These are
She's probably gonna,
All right.
probably gonna be some amount of injury from being in the hot air.
So what do you guys think? It's lots of fun, huh?
Possibly these people are not supposed to have.
I was thinking it's not.
There's what I'm wondering if it's like too late.
Yeah, it's gonna be a better.
Writing questions in your
I mean,
future.
that could be
Writing questions in your future. This is all.
And it also gives us a good, like, distractor.
Do you know, like, is there a particular way to make those stuff? That's right.
You have to write a curriculum, you have to write a certified.
Carbon dioxide shouldn't have that either.
You have to get the criteria, because we get grandfathered in.
I'm trying to dig out my.
That's one of my attending to residency helped do the EMS stuff when I got the grant and failed his first
Carbon
semester.
dioxide, dig it out.
It's like, I wrote this stupid exam.
Oh, wow.
No, you're right. But no,
Okay, well, I'm glad you guys might.
I use it more.
I've actually
Using it as
using
Those are all great.
If you're interested in doing more of this, the CDEM, it's the assessment and committee within CDEM, that basically helps maintain that vacancy here. We could always use more people, even if you just want to like bring questions or just email them to me and like have no part in any of this. Like,
I guess it, if
Like,
enough time to get to the point.
Well, revamping the practice test and doing answer explanations.
yes,
Um,
yes.
See, I'd be happy to.
We can make it slightly higher, just enough.
So, this is the part
Yeah,
where
I know. You mean it's 90 over 50 is big.
Actually, has been working with various AI. Some of these questions are actually AI generated.
There's a timing.
And so we're gonna kind of see how that performs. My personal take from this experience is like, I think they offer some great starting points, but we'll still need revision, but that's okay, because a lot of times teachers are like, to see a question and be like, ooh, we just need to tweak this a little bit, and it's like, oh, I'm not gonna do this. So,
So I feel like that's gonna be key.
yeah.
92% on
do you know which one? We're not there yet.
I don't have a perspective yet, I probably have an Excel sheet where I track which ones.
Well, I guess she's unresponsible.
I find it especially helpful for like distractors.
I didn't.
And they did say
That's
direct.
where I find it. And but those are two very plausible, otherwise you have to do a lot better.
But yeah, I think
I also think for thinking of topics from a text, like coming up with
We can make the
topics,
number higher.
like, this is a text,
Our eyes help the leaders.
give me some questions from the objectives of this text.
One thing I do is just instead of very similar to the style that there's subtext, there's syntaxes, it's just like my quick just blurting of like write a question about that, but the model pulls the sentence structure, the stem length, that's where
They have good details, students get rid of those abbreviations,
Yeah.
that, like how the editing stuff.
Yeah.
There's a lot that you can do with these things now, and one thing that I learned from you guys was, I thought that the highest level model would be the best for this, and from watching you guys go through it, the highest level model actually introduced more confusion when you got going through it than my initial. It put too many words into some things, so I got a lot of stuff to take feedback to work on it for, but to one of your questions of where is it going to fit in, this clearly showed me that it will never get to the point that you will not need this. You will always need a round table But I think that draft.
I saw something on the 5 choices too.
If you guys are going into it more stuff, if you have questions, I'd be more than happy to talk to you through what certain models.
I even need to watch it.
Absolutely, everything.
Yeah, we should unresponsive.
We're gonna play around with it.
Yeah, that might be most helpful for you too. Yeah, I'm fairly well established. And we're already working from, and I think the pool of questions we're already dealing with, so. I think as you just get started.
Other disaster medicine.
It's kind of great, all of us think I'm
That's definitely.
I bet you.
So that's not part of the student curriculum.
Should be.
Oh, yeah. I also think we were talking about.
We just had a long review of the curriculum. And there are things that all people want in the curriculum that cannot fit.
That's kind of like the last year.
Oh, I know.
At the bottom, so.
Yeah, this is the history of disaster medicine.
I mean, it could be an advanced curriculum, like the next step is thinking about like the
What do you take out? What can we take out? What is disaster medicine? That's the problem.
I mean, in the advanced, we can add to it, right? If you say that the average student gets all of everything in this, and then there's an advanced student that you add another level.
The flip side of it is to think about it the other way around, like what are basic principles that are super important for disaster medicine? Like one of the things we started doing in conference already last people, about Harvard, where medical one is like, ridiculous thing, but they want to have conference time, we don't have conference time to give you. But if you want to talk about the initial management of X, Y, Z and how it differs in the field from the emergency department, like, there's a lot of crossover here, so let's see why we do that. Like, short about patient, where do you start, what do you do, what do you think about, what things do you have to feel, what do you think about, what do you do?
Do your students participate in your exercises?
The ones that are rotating when we have exercises.
They're the lucky ones.
Yes, exactly. Just like when I did my PMS rotation as a medical student, they were having a day where they practice extractions at an amusement park just north of Richmond, and so I got to like put on the gear and let's go roller coaster, and it's like one person they got to do that.
That we're doing like disaster tools. I brought my kids along, and they started out with just, I gave them a couple scenarios of what they should be doing. And by the end of it, they were covered in fake blood, just having a great time. They brought the funeral home, or non-be there too, so I had my kids be taken by the funeral home.
Oh my
several
gosh.
times. I just didn't worry
Yeah. So I'm actually doing a study on that right now. How do you limit emotional harm to that child acting as a simulated pediatric child?
was great.
Yeah, my kids are like, forget it.
They're in.
Oh, they're in there.
Well, that's the whole
Yeah.
thing.
They're totally, yeah.
Because there's a pediatric simulation.
Well, in our clinical skills person mentioned to my children, take your psychology, how you would come in as SAEs. She's like, I'll see you $26 an hour, and now they've got the fixated. They're like, I want to do this summer. And I was like, A, I don't know that it's legal. And so, and B, like, you can't do it during the school year, so how are you going to do that? Like, it would have to be, so she talked about doing it for like the grad OSCE, but.
Maybe that's the answer to your studies, they just need to be children of physicians.
Oh my God, they used to have them all the time.
That's exactly where this all came from.
Yeah.
I'm part of a consortium in Europe, 13 million euros grant, looking at wristbands for mass casualty incidents. You get like better than Fitbit, it shows telemetry to incident commands, and they want to test on kids. So the Paris Center for kids of responders are in this.
Yeah.
And I'm describing this to my pediatric pediatrician. She's like, how does it do that?
My kids are good at
And I was like, yeah, we had like.
She comes in and does like intubation. She's heard me give my lecture on cardiac arrest so many times.
That's what it is.
We talk about the family coming in while you're doing CPR, and I'm just like,
Well, my kids quickly found
My poor
that
children.
being sicker was much more fun than being healthy. So
Oh,
they
and
quickly,
yeah.
they quickly,
Their acting
each
skills are
time, yeah, each time they reset, they had more injuries and were more labored breathing, and, oh, I just can't do it. You did a great job.
Oh, perfect.
Yeah, they were
And
great.
the story we're still talking about.
Oh, yeah,
They were cool.
yeah.
Amongst their friends, they're cool.
I'm sure their friends have no idea what they're
Thank you.
I just need to get a bottle of fake blood at home. I think
Yeah,
my wife would go crazy, but my
I
kids
did a
would
thing
go
with
crazy.
like high school students. Roles of I did
Twenty
the
bucks.
big blood and squeeze it and then it like gurgling and it's about packet. So
To
practice.
be fair, we threw a bunch of them, so. 1, 2, and from that, 1, 2, that's where.
Who was going back to visit my own school, they go through similar, and they're like, okay, we get to do this, and they whip out the Lorraine just go, they're AT2, when do I get to do this?
All right, you guys find this useful?
I don't see it as traumatic.
So actually, if you just go to NVME volunteers, there's a whole webpage about it, and there's a thing where you can click in, and what you probably want to click out is TMVC testing. Actually, there was I don't know that one. And I Googled
That
it.
time your kids were on the call. I was like, mine are teenagers and just.
I was just like, oh, so like my 11-year-old, I left at like 4 o'clock in the morning. My 11-year-old.
Things going on.
I think we're all good. So, thank you, it's a great question.
There's a guy.
And I said, Mom, and I said, I'm in a section. Okay. She's like, and I'm like, how was school? Fine. She's entering the.
Yeah, so it's, I'm glad
She's
you
here.
those students are doing the advising, the that's a population that says, oh, you guys. That's fantastic, good.
How are you?
Good, how are you?
Good.
I just saw the message, I sent it to you like through like the, well, last time we were on Zoom, I sent you like a private message on there.
Oh, yeah.
Well, I went like,
That's like the step two.
I didn't work with that, I watched the baby and did all this, I find it.
Yeah.
I like it.
Yeah.
I think I might put myself into, trouble per se,
But everybody wants you to fix it.
Yeah.
So that's just,
Yeah, so we have a curriculum.
And we have a canvas developer, but she doesn't understand enough about how this works.
Okay, yeah.
And so,
Trying to get
Okay, so do you have really?
I know, that's the thing that always happens, because like, they're gonna send us some shitty, and like, Thursdays, it's really fun.
I have all these new buttons now. Have buttons in my new one.
Well, I was like, I love
Good.
it.
I'm here, thank you.
They come to it and take it apart and make it work exactly how it is. It's an expensive course, and they're like, oh man, you really guys, this is
Yeah.
awesome. They're like, they've been using this, our psychiatrist one for their example. That's not great. Thank you.
Yeah, you're
Because
welcome.
it's really good.
I know, I use it.
Students love it.
We've been working on it for a while. Okay, I'm gonna go check in.
Go check in. Thank you very much for coming.
I was late.
It's quite all right. You were totally fine. I appreciate you being here at all.